Well, we will call this Tuesday, January 15th, 2019, Board of Health meeting to order. The agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may be in fact discussed, and other items not listed may be brought up for discussion to the extent permitted by law. WACA Television is broadcasting this meeting live and will rebroadcast it numerous times. Is anybody else in the room recording the meeting? Seeing none, we will start with citizens' participation. Is anybody here for citizens' participation this evening? Seeing none, we will move to Sergeant Ed Berman to discuss the Narcan and opioid statistics in the town of Ashland. Good evening, Sergeant Berman. Thank you for coming.
No problem. I'll start off, this has been a journey for us, along with the rest of the country. So in 2016, the Ashland police were the first police department in Metro West to start carrying Narcan and training all of our officers. So some of the statistics I have, in 2016 we had 18 opiate overdoses in Ashland, and we had 5 deaths. In 2017, we had 14 overdoses and 2 deaths. And I'm happy to report in 2018, we had 10 overdoses and 2 deaths. And in 2019 year to date, we had 1 overdose, but that was non-opiate related. A couple of things have also come forward with us. Initially, we started off with the 2 milligram doses of Narcan, and what we were finding was that in a lot of the cases we were going to calls, we actually needed 4 milligrams. So we had to administer 2 of these, set them up. It was kind of a process to set it up. You had to open it up and kind of do it real quick. You had to open it up, set up the whole thing, put an atomizer on the end. So it was kind of time consuming also to kind of get everything all set up. What we did about a year and a half ago, we actually switched to the 4 milligram dose right off the bat. People were just getting 4 milligrams. And what's nice is this is just open it up one nostril and inject the Narcan. Again, retraining all of our officers. Another thing that the state has done is they've now mandated that every police officer in the state, as part of their annual CPR first responder training, actually has to be retrained in the use of Narcan and how to identify opiate overdoses.
Questions for the board?
Yeah, I had to send some questions over the email to find out how many of them repeated.
Yep. So in the 3 years that we've been keeping track, only 2 were repeat residences that we went to.
How many years is that? Repeat?
So from 2016 through today.
Oh, they've been still repeating.
We've only had 2 that repeated once each.
Oh, once each.
Sorry.
So that's fine.
Anything else?
Yeah. What are we doing with the remaining Narcans, and how do people know that there is availability and who can get that access to?
So I know our Board of Health has done a great job trying to get the word out that people can come to our Board of Health to get trained how to use it and be able to leave here with some doses of Narcan, especially if they have a family member that might be addicted to opiates, that's not seeking treatment or doesn't want treatment at this time. People can also go to their local pharmacies. The pharmacist will show them how to use it. We actually had a discussion today about maybe working with Beth to do something with our Ashland Business Association and train some members from all the businesses in town and give them doses of Narcan in case they have an issue with someone coming into their business or an employee. So just trying to spread the word as much as we can. Again, this is something that, we can only offer people treatment. We can try to get them into treatment. We can't force them. That doesn't work. But hopefully by educating people, educating families, that's the best way to do it. And I think that's another reason our numbers are coming down. We're getting more people into treatment, and we're educating people more and more.
The question is that are these people more likely to go to a liquor store than anything else?
I don't,
In that case, maybe they are the ones to be provided with all these Narcan so that they can supply it if they need to be.
we're gonna open it up to all of
Yeah.
our businesses, the training.
Well, if I may, one of the reasons why we asked Sergeant Berman here tonight is we knew that this meeting would be well-attended, and more importantly, it would be attended by business owners. And no matter where you come down on the opioid crisis, it's fair to say it's the biggest health crisis that anybody in this room has ever faced. And the fact that people are dying in our community, and we have resources that essentially are sitting on a shelf and not being used is one of the reasons why we wanted to bring it to the retailers. And you don't have to raise your hand tonight. You can contact us via email or call the Board of Health office. But what we will do is we will be proactive to you, and I know Sergeant Berman will be as well, is we will come to your place of business and we'll teach you how to administer Narcan. That's how serious that we are about it. We're committed to doing it. We'll find the time to do it, and more importantly, anybody watching this meeting, if you have a person, a loved one in your family or a coworker that you're concerned about, reach out to us and we'll extend those trainings. We'll figure out a way to get it done. Because we do have a grant from the state where we have Narcan, and God forbid somebody passes away because, you know, the Narcan's sitting on a shelf and not with somebody. Now, every police officer and fireman carries Narcan?
Correct.
Is that correct?
Correct.
So all of our first responders have it.
Correct.
Is there a shelf life for it?
About 2 years.
2 years.
But a couple of other things I just want to mention. Metro West Medical Center was really great. They helped all the police departments in Metro West come up with a replacement plan so that the burden of the cost wouldn't come back to the cities and towns. So if we administer Narcan today, I can go to the hospital and replace that Narcan through the pharmacy at the hospital at no charge. They've been a great team player in this. I also want to mention, one of the other things that we had to make sure as police officers is that people have to understand that if you call us for help, and you have a heroin problem, fentanyl problem, whatever, you will not be arrested if you're calling us for help. We are going to try to help you seek the services that you need. Also, just for people that are watching, the town has a social worker that works at the community center. Her name is Jennifer Wolfing. She can be contacted directly also, and she can help people get into treatment and help them with any services they might need.
So all of these information is on the website about where to get the help and everything?
Correct.
That's good, that's good.
But I think the key point that you brought up, if you reach out for help, you will not be arrested.
Correct.
That's the key point.
We want to help you and your family.
So even if a family member hypothetically says, hey, I'm concerned about this family member,
We will try to get you the services that you need. You do not have to worry about getting arrested. That is the last thing we are ever going to do.
okay. I think if we take nothing away other than that, then that's good.
Thank you.
Because, this board wants to be proactive in the community, and I think this board, and unfortunately for the board, I'm the spokesman of the board, is that the stigma of the opioid crisis has to affect, because there's probably nobody in this room who doesn't know somebody who's addicted to opiates, good, bad, or indifferent, or what it is. And, we have the resources, we have the staff that's trained on it, and it's up to us and it's up to everybody in the audience to be aware of it, and we're here to help.
And one other thing, just give some kudos to Decisions at Every Turn too. Last year, and Kelly Sinker at the high school, last year we were able to put every single 10th grader through an opiate education program, and we hope to do again this year through all the wellness classes.
Awesome.
Any further comments?
No, just a expression of appreciation to you and everybody else that's working hard on this. Thank you.
Sorry, just one question. Obviously, you couldn't be on all these calls, but the people that did pass away, was it because of a time lag in getting them a medication, so that the CNS was already too depressed that Narcan wouldn't work, or were they already dead when you got there?
A majority of them were already dead when we got there. They had been down a long time, beyond that 4 to 6 minutes where they stopped breathing.
So you have 4 to 6 when you get a call.
Exactly.
That's
We got to get, because their breathing is slowing down, we've got to get to them.
Understood.
Yeah, and that's again why we really encourage families to come here, go to their pharmacies, get the training. If you have somebody that won't go into treatment for now, have the resource at the house, then call us, because sometimes you need more than one dose, And, you know, at that point, we're gonna help try to get that person the treatment and/or get the services that the family might need for the future.
I'm surprised those numbers aren't higher than with what you just said.
Yep.
Good job by you and all the first responders. That's great.
Great. Thank you.
Thank you. Thanks for coming tonight.
You're
Keep up the
welcome.
good work. Thank you. All right, we're going to move to our public discussion on tobacco regulations and flavors. Couple rules that we'll go over. First, is everybody in the room signed in? Anybody in attendance? Everybody that's here tonight that is anxious to speak will be given an opportunity to speak. Couple ground rules. When you come to the podium, you have to state who you are, what your address is, and then we're going to have respectful conversation tonight. Tonight is just a discussion. No matter which way you come down on the argument, on the side, it's going to be a respectful conversation. I, as the chair, will moderate that. All questions to the board come through the chair. And like I said, we'll have a civil and productive conversation. With that, we do have a VIP guest here tonight from the Attorney General's office, who I did promise that I would get her out. So if she wants to come up, and we will start the public discussion with that. We have a couple letters we will read into the public record after Elise speaks, but good evening and thank you for coming.
Good evening. Thank you for having me. Bear with me, I'm fighting off a cold. My name is Elise Yannette. I work in the Policy and Government Division in Massachusetts Attorney General Maura Healey's office. I would like to thank the board for inviting someone from our office to speak today. And I just want to share with you a bit about the work that our office has been doing to address what we really think has become an epidemic of youth using e-cigarette products. I'd like to share a little bit about how we came to learn about this. And when we came to learn about this, I'd say roughly a year and a half ago, we started to get calls from a lot of different types of constituents. Calls from police chiefs, calls from superintendents, teachers, parents, school officials, expressing concern, saying that they had youth that were vaping and didn't know how to address it. It was really the first that we were hearing about this. We also have an initiative, and the AG and I have visited a number of classrooms, middle schools across the state as part of our prevention education program. And we would visit classrooms and talk to youth, and the number one issue that the middle schoolers wanted to talk about was vaping. We visited one school on the North Shore, about 20 middle school students, and when the teacher asked them, how many of you know someone that vapes, every single hand in that classroom went up. And the students shared that some of their friends were so addicted that they couldn't stop if they wanted to. So we started looking into this and learning more about this phenomenon. Juul was the popular name and brand that we heard, and that was consistent with what we were hearing from pediatricians who had reached out to us to express what they were seeing among their patients in their practices. We learned that Juuls are so popular among youth that juuling has become a verb. We learned that the nicotine concentration in one of those tiny pods is equivalent to that of an entire pack of cigarettes. We learned that according to the U.S. Surgeon General, the rate of youth e-cigarette use has increased 900% over the last few years. And we learned that according to the statewide survey, almost 50% of high school students in Massachusetts reported having ever tried vaping. And we know that nicotine is extremely addictive, and its harmful effects are especially relevant for young people whose brains and bodies are still developing. And I think most concerning, and from our office's perspective, we noticed what seemed to be a lot of the same tactics and marketing strategies that were used with the traditional tobacco companies prior to the master settlement agreement. So what have we done? First, back in June, we sent a letter to all public school districts. At the time, we had learned that Juul, representatives from Juul Labs, the company, had actually been reaching out to school districts in Massachusetts, offering to come in and meet with them or have presentations and we're providing monetary incentives for their prevention program. And we had just heard from enough school officials that we wanted to send out a letter addressing what was becoming an increasing public health concern. So we stated that there clearly is nicotine in these products. We had learned that according to a Truth Initiative survey, 60% of youth users don't know that there's nicotine in these products. They think it's just water vapor and flavoring. So we clearly stated that there is nicotine almost always in these products. It is harmful to youth. We encouraged schools to please not accept the offer from Juul and provided them with a list of alternative educational resources that were not tied to industry. And we also encouraged school officials to file complaints with our office if they were aware of online or local retailers that were violating the law and selling to minors. Shortly after that, over the summer, we announced that we are investigating Juul Labs over their marketing practices and over their age verification system. And we also announced that we were taking enforcement actions against 2 online retailers that operate 3 websites, Direct eLiquid and Eon Smoke. We sent them cease and desist letters, believing that they were in violation of our e-cigarette regulations and state law. And I'm proud to say that they both have since ceased operations in Massachusetts. The websites are still operating, but they have stopped selling and shipping orders to Massachusetts customers, and our investigation into both of those 2 entities is still ongoing. We also announced that we are investigating brick and mortar stores that we know are also part of the problem here and have sold to minors across the state. And since then, we've continued to hear from parents and students. I have spoken with multiple parents now who have called me. Their children are so addicted, they don't know what to do, they don't know where to turn. A parent out in Western Mass called shortly after our announcement that we were investigating Juul, offering to help however he could. I must have spent an hour on the phone with him. He said, "My son was so addicted, it took me a while to figure out what was happening, but when I did, he was up to 4 Juul pods a day." And this father tried everything, and he resorted to getting his son into a youth detox facility for sort of traditionally for opioid users. I've heard from a number of parents who just have had heartbreaking stories, and these are top students, athletes, top academically, who are very addicted to juuling and vaping. We have been heartened by the actions by the FDA. We think that federal action is needed and look forward to the FDA continuing to take action in this space. But I did just want to say that because we've received some questions on this, that regardless of the FDA's actions, our investigation into Juul is still ongoing, and we are going to continue to take actions as our office sees fit against entities that are breaking the law, and to do what we need to protect the youth in Massachusetts. And we also continue to work collaboratively with state and local stakeholders to address this issue, thinking about ways that we can increase educational programming around youth, think collaboratively about bringing resources towards treatment, and we are going to continue to do everything we can to enforce the law and hold people accountable. I know that the Attorney General has expressed a lot of concern around some of the flavoring that is available in these products, and we want to make sure that these products are being sold to adults and not marketed to minors, and creating a new generation of nicotine users, when I know a lot of people in this room have worked incredibly hard to get the combustible smoking rate down to single digits. So I want to thank you for your time, and I'm happy to take any questions.
Is there any legislative action that's been planned for reducing such activities that go on?
So I can say that, as I'm sure you know, the new Tobacco 21 law, which was passed last session, just went into effect, which our office was very supportive of. It's the other I forgot to mention. We are also in the process of updating our website and producing some information to hopefully advise both retailers, boards of health, general public about the new Tobacco 21 law and to reinforce what is required under state law generally. In terms of this upcoming legislative session, I think our office is waiting to see what is going to be filed. I've heard rumors around possible taxation, around addressing some of the flavoring issues, but I know the filing deadline is this Friday. So I know we are going to be looking through the legislation that is filed and are going to read through the language and make decisions about supporting some of those publicly.
Because I know that we went ahead with 21 long time before the state did it, so if state would take better initiation in doing things, it'll lessen our burden for it.
Yes, yep,
Thank you.
thank you.
I was gonna say, the only question I had for you is the people that have contacted you with an issue within their family, did they happen to, thank you, John, did they happen to say, because that's what's on the table tonight, whether it was like a flavor, was it the wintergreen mint or menthol, was it mango, was it strawberry, have you had any inclination of what type of products they're using? That's what we're talking about tonight.
Sure, I can say, so in terms of the parents, as best I can recall off the top of my head, in terms of the parents with children who are addicted, I think in terms of product, the most popular was Juul. I only heard from one parent whose son is, well, now in recovery, who said I'd been in touch with her right around the FDA actions, and she followed up to say, you know, it's great what the FDA is doing, but the problem that her son was having and his friends are having is that they're all using mint, and she was concerned because the FDA actions weren't going to address that. So that is, in terms of parents with addicted children, that's the example I can think of. Anecdotally from other folks on the ground, I've heard from school officials and folks that work in schools, and I've seen actually photos of devices that have been recovered by school resource officers and such that show that at least half or many of the products being recovered are mint.
The city of Somerville early this year banned the flavors that we're discussing here tonight, and on Friday morning the town of Needham did it. There is rumor, and you know what rumors get you to, is that there will be possible litigation against the industry, against maybe Somerville or Needham. Has the AG's office seen any of that chatter? And does the AG's office, and it might not be a fair question, so I apologize, but does home rule effect in Massachusetts apply? Does it, can the towns be indemnified from action against the industry, or is it, or is it going to be, if it, hypothetically, Needham, and the industry goes after them, is the state going to protect them, or is that just going to be upon, their town government to mitigate those?
So what I can say is I had heard prior to Needham and Somerville adopting those ordinances that they were going to be doing so, and have heard that there may be other municipalities considering the same. That being said, the conversations I've had were not directly with those municipalities or boards of health. I think my understanding, though I'm happy to confirm and get back to you on this, is that local town council would be the first course, but if there are municipalities concerned, our office would be happy to speak with them and discuss the matter further.
Question of affordability, that's what the problem comes in when you come with a large company hitting with a lawsuit. So if the state can step in there and protect all of the towns which is being hit, then we can rely upon you and then proceed with it.
Yeah, I mean, I am happy to, we can absolutely follow up, and we'd be happy to talk about it, and I'd be happy to get back to you about the home rule issue as well. I mean, I think we understand, we have an investigation into Juul Labs, which is now a $75 billion company, so,
And once again, maybe not a fair question, but I mean, how long do you think that investigation and process could possibly take?
So right now we have sent what's called a civil investigative demand to Juul. It's sort of more commonly referred to as a civil subpoena. So we have requested a significant volume of documents from them. it's hard to say how long these investigations will take, months, sometimes years. We have, allocated as many resources as we can to this issue because we want to get to the bottom of this, and review those materials and decide on the next action from our office as soon as possible. And folks may know, that could, the range of actions that may happen, that investigation may conclude with no additional actions being taken. That investigation could result in a settlement, or that investigation could result in a lawsuit. So I think we are moving as quickly as we can to determine the next steps.
Mark, do you have any questions?
The only point that you made was, again, looking at this maybe in numbers of communities doing it at the same time. And I was on a conference call with the Commissioner of the Department of Public Health today, and pretty much asked the same question a little differently from the litigation, but when will the state be considering banning flavors such as mint, menthol, wintergreen? So, they answered by saying we always look at the locals first, but I think a strong message to send back to our Attorney General is that we're looking at your assistance as well. We can't do this by ourselves.
Yeah, we would be happy to speak with you in terms of if there are concerns about, lawsuits. In terms of a ban on the statewide level, that does need to be done by the legislature. And my understanding is that, I know last session during the Tobacco 21 discussion, there were senators on the floor that filed amendments wanting to ban flavors, and I think have a continued interest in doing that. And we're happy to work with them as well to address the issue on a statewide level.
If I may, it would be appreciated, especially since the Surgeon General came out with a statement on the dangers of juuling and vaping, which they don't usually do unless they have plenty of scientific information. It takes years. But this is one of those concerns that they had to come out immediately because of the increase in nicotine addiction with our youth. So we all need to band together, federal, state, and local. That'll be my comment.
I believe that if the state can take action on it, it will save thousands of hours of the Board of Health time from various communities, so they can attend to something else after that. So, and I don't see a reason why they should hold on to it if the results are very positive to show that it needs to be banned.
Yes, and I'm happy to, we work frequently with our colleagues at the legislature across the street, and I'm happy to, as I continue to have conversations with them about this issue, bring back your concerns and let them know, and can raise with the Senate President, that this is an issue that is very important to you.
Is there something that we could do, talk to the senators or reps?
I'm sorry?
Is there something that we all could do to talk to the senators or the representatives to help us out?
Well, I'll make that easy for you, because our Senate President does live in our hometown.
Yes.
I've reached out to her office, and she will provide written statement on this as well.
Okay.
Yes. I've talked to her legislative aide quite a bit the last couple days, so, yeah.
Great.
Yep.
And we're happy to speak with them as well if they have any questions about the work our office is doing. Happy to answer any questions that they may have.
Well, thanks for soldiering through with your cold, and we really appreciate it. And we
Thank you
appreciate
for
all the
having
work
me.
that the AG's office is doing.
And thank you for addressing this issue.
Thank you. Hope you
Thank
feel better.
Thank you.
Before we get going to public comment, I was remiss in mentioning, we have, 4 documents? 5 documents up here. We have a letter from Senator Markey, which we'll read into the public record. We have a letter from Ashland Superintendent. We have a letter from our town council. And what's that other letter there?
Adam Ponte's attorney.
Attorney, we have that, and we also have our regulations. These are public documents. Any and all, or you guys are welcome to if anybody wants one. But with that, we're going to read a couple of them into the public record. Attorney Conti's going to speak to his, and our council piece we'll talk about as well. But I wanted to read, if you want to read Superintendent Adams into the record.
Mr. Chairman,
Sure
if I may,
thing.
can I ask by a raise of hands how many people need them, and we can go make copies?
No, if
If they want them, they'll come up and get them, and we'll get copies.
Okay.
Right,
there's
we'll get
only a few
copies.
left.
To Chairman Featherston, board members, and Health Director Mark Oram, as Ashland Schools Superintendent and former high school principal and athletics director, I strongly support the proposed regulation to restrict the availability to our youth of menthol, mint, and wintergreen flavored tobacco products. the U.S. Surgeon General, the head of the Food and Drug Administration, and the Institute of Medicine, among many others, have documented the highly toxic and addictive effects of these flavors. The American Academy of Pediatrics, the American Lung Association, the American Cancer Society, the American Heart Association, the Campaign for Tobacco-Free Kids, and the Truth Initiative emphatically agree. See, for example, then there's a website there. In a rare advisory in December 2018, the Surgeon General specifically urged local and state governments to act assertively to protect their youth. Both he and the FDA Commissioner, Dr. Scott Gottlieb, have recently called the use of Juuls and other e-cigs, vapes, an epidemic among youth. We need you to protect Ashland's youth from this new epidemic at tonight's hearing and in the future. It's that simple. Sincerely, James E. Adams, Superintendent.
And then right before this meeting tonight, I spoke with Senator Ed Markey, and he asked that this be read into the public record. Dear Chairman Featherston, I appreciate the opportunity to comment ahead of the Board of Health's public meeting to discuss Ashland's current tobacco regulations, specifically the continued availability of menthol-flavored combustible tobacco products and mint and menthol-flavored electronic cigarettes or e-cigarettes. For years, I have raised concerns about access to mentholated products on the market. This is an important conversation that can improve the health of residents across the Commonwealth. Research shows that menthol in cigarettes increases tobacco use initiation, particularly among youth and communities of color. According to a 2011 report from the U.S. Food and Drug Administration's Tobacco Scientific Advisory Committee, by 2020, 2.3 million people will initiate smoking, and 17,000 lives will be permanently lost if menthol cigarettes are not taken off the market. Furthermore, more than half of youth e-cigarette smokers use mint and menthol flavoring. With more youth smoking e-cigarettes now more than ever, we can spare no action to prevent another generation from getting hooked on dangerous tobacco products. In 2017, I called on the FDA to remove mentholated cigarettes from the market. The FDA heard those concerns and recently announced its intent to ban menthol in cigarettes, cigars, and other combustible tobacco products. I am encouraged by the FDA statement, but I believe the agency fell short by excluding menthol and mint-flavored e-cigarettes from its intended ban. Last month, I led a group of 14 senators in urging the FDA to go one step further by removing all flavored tobacco products from the market, including mint and menthol e-cigarettes, unless and until the agency has thoroughly examined any public health benefit of these products on smoking cessation. Removing mentholated tobacco products from the market will be a great stride in improving public health and would safeguard a brighter future for generations to come. Signed, Ed Markey, United States Senator. Like I said, we do have a response from council that you requested.
Correct.
It's very lengthy.
Very lengthy.
Do you want to read it or have a comment? Or save that?
No, I just thought we should run it by council, about what we're looking to do. So, I mean, she was advising us that Somerville, I believe it was Somerville, had suit filed against them, in Yarmouth, I believe, but not Needham yet, because Needham just had them.
Right, just on Friday, right. And with that, I know the attorney who presented the document, I think it would be fair after we read those, if you'd like to come up, sir, and give your point of view, would be much appreciated. Good evening.
Good evening, members of the board. As you know, my name is Adam Ponte. I'm an attorney with Fletcher Tilton, and I appreciate the opportunity to present again in front of this board. I think this is the second or third time that I've been here, so in the interest of time, and I recognize that there are a lot of people here tonight. We have a full house. I'm not going to repeat or reiterate sort of the points that we discussed at the first time I stood at this podium, and then we had a meeting at the table. But what I really wanted to do, and just to make sure the group here tonight understands, I represent the Coalition for Responsible Retailing. It's a retail association that looks out for the interests of the retailers, convenience store owners like the ones you have here tonight. And I promised you at the last meeting that retailers would come and they're going to share with you some of their experiences and what type of effect this ban as proposed would have on them. So really the point of me being here is just to provide you with an update sort of where we stand from my client's perspective. So yes, Somerville affirmatively voted unanimously to make a mint, menthol, wintergreen, and tobacco-flavored non-combustible ban, effective starting April 1st, 2019. About 3 or 4 weeks later, 4 weeks later, Needham had its public meeting. They voted as well, although it's my understanding that ban, it's mint, menthol, wintergreen, doesn't have the included definition for the tobacco-flavored non-combustible. Their ban will take effect July 1st of 2019. So as a result, just in the interest of being fully transparent, we've had a good relationship. I've been retained by a handful of retailers, Somerville residents, registered voters in Somerville, to bring a judicial request for judicial review and challenge of the voted-in regulation in Somerville. So they share the same jurisdiction as you, Middlesex County. And the letter that I submitted to you just was in the interest of fairness. I just wanted you to know that my firm's been retained. We represent these individual store owners, and we expect to be filing within the next 10 to 14 days. And so you're all asking yourselves, well, what is the basis for that? I mean, we're a board of health. We're making public decisions, and I'm not up here to dispute. E-cigarette use amongst the youth in your community around this country is an epidemic. I'm not gonna, make excuses. I'm not gonna tell you that it's okay. But what I wanna make sure that we're all paying attention to is being able to compare anecdotal evidence versus hard evidence. We've heard some comments tonight about conversations with parents, conversations with school teachers, conversations with children. But I just want to make sure we keep an eye on what is the hard evidence and the data that we have. So with that being said, I did also provide, as I promised, a separate cover letter that encloses 2 specific studies, and I recognize one of them is extremely lengthy, and I provided you with citations to that. I sent it directly to Director Orem this afternoon with citations, so you can flip right to the pages and you can see what I'm talking about. The reason I wanted to share those with you, and I'm going to get into that in a moment, and why my clients believe that the regulation that is being put forth, it's unlawful, arbitrary, and capricious, and in excess of any Board of Health's authority. It's really stated simply by the expert we've retained, and I want you to look into him. Dr. Michael Siegel, he's of Boston University. He's a physician, and he's a PhD, and he is anti-tobacco through and through. My understanding is he's never testified on, we'll say, my side of the aisle, as we call it, the more, what we'll say, unpopular position. He has testified in hundreds of tobacco death cases, but he is vehemently opposed to the menthol wintergreen ban. Why? Because this ban gives an unfair competitive advantage to the combustible brands. Stated simply, you are now going to have Marlboros on everyone's shelves. That's it. And a couple Camels. You're going to literally put on your retailer shelves Marlboros. That's it. And we know, and it is not disputed amongst medical doctors and scientists, that combustible products are far more dangerous than the non-combustibles. That's what the Royal College of Physicians report focuses on, that the non-combustibles are a gateway away from the combustible products. Now, I also recognize that some members of the board here and in other towns have said, well, the adults have had their chance. We're worried about the kids. But that's not a public health decision, respectfully, to say, well, we know that kids are starting to use it now, so we're just gonna do what we can for them. It's also not disputed that Marlboro is the most popular brand amongst youth. And I'm not making this up. Dr. Siegel will testify to this information. He will tell you that he's anti-tobacco. He'll also tell you that what wouldn't be arbitrary is a wholesale ban on tobacco, flavored or not flavored. But to do this sort of halfway point decision of deciding what can and cannot be on a retailer's shelves, and to leave on the shelves the combustible Marlboro products, it's compelling the adults who are trying to quit, who use e-cigarettes as harm reducers, to use the combustibles again. If they go to the same retail store every night to get their food and their snacks, and now they have one choice to make, they're gonna buy the Marlboros. So respectfully, we don't believe that keeping those on the shelves can be a public health decision. And on that point, again, I'm stating this in sort of a colloquial manner, we would contend that therefore such a ban is not a public health decision and constitutes a decision in excess of the board's authority as a board of public health. So I also mentioned to you that a number of retailers here in town are concerned. I'm not going to speak for them because they're here tonight to tell you about revenue, how this will affect their businesses. But I just ask that the board just carefully consider both sides of the table. You have a lot of people here who are proponents of the ban. I'm here tonight as an opponent to the ban. That's all. And the last point I wanted to make was I know that we had discussed a possible task force with a proponent of the ban, a member of your board, a representative of your retailers here in town. I was just interested to know if that's actually being considered, if you would be willing to sit down with some of your store owners to talk about actual problems they have, because I know we had a disagreement about your local compliance rate versus FDA data. I think in the last 3 years, according to the FDA compliance checks, your town has a 94% compliance rate. I recognize that your town does its own local checks. I'm not privy to that information, but sort of knowing that your gatekeepers are doing their jobs, they're investing their money into training their employees, they're taxpayers here in your town. I think we owe it to them to give them an opportunity to converse with you and to have their opinions taken into account. And so I appreciate your time. If you have any questions for me, I'm here to answer them.
Your statements show that contrary to what the FDA as well as the U.S. Surgeon General says, how come you're not able to convince both the FDA and U.S. General with your documentation or your supporting documentation to make sure that they can change their views on it? And we rely mostly upon the government supplied data, so the U.S. General thing. That's one. The other thing is that I know that way back people used to use DDT, and I'm sure the DDT company which manufactured would be suffering once it is banned. So economic things cannot be used for health purposes on all cases.
So to address your first comment about why is the FDA or the Surgeon General not finding persuasive the information that I'm presenting to you. So first, I can't speak specifically to bringing action or requesting a change to opinions of our federal government. I've been retained to represent store owners and to prosecute claims in the Middlesex Superior Court relative to the Somerville Board of Health's decision. But what I can tell you is if you read Commissioner Gottlieb's memorandum, November 15, 2018, carefully, the title is deceptive. You should read, I don't have the page citation, but you should check out what he says about mint, menthol, and wintergreen. He says he's not taking explicit action on those products for a reason, and it's what I'm telling you. That he recognizes that those flavors are widely used by adults, not children, and that those products have a social utility of helping adults quit use of combustibles. It's in his memo. Now, I recognize that some of the news headlines say that he's going after all of the flavors or he's seeking menthol ban, but if you read his memo, he has a specific paragraph dedicated to why mint, menthol, wintergreen is not being acted upon at this time. Your second point, relative to saying that economic harm shouldn't drive public health decisions, I agree. You're Board of Health. You are not making decisions based on business regulations. I think I want to make sure I'm clear. My position is that because you're leaving the Marlboros on the shelves, that actually does seem to be a business decision. If the proposed regulation was, hey, tobacco's dangerous, it's causing problems in this community, kids are addicted to it, let's not have an arbitrary decision here. Let's just ban it all. That's not a business decision. That's a health decision.
Yeah, just one of the points you made earlier, you made reference to, I should say, is the compliance checks. And I think compliance is an important thing, and compliance figures and statistics are important. But I don't think they tell the whole story, because there is enough hard data, not anecdotal data, that indicates that this stuff is still getting into the kids' hands. So how that translates from compliance checks to the reality, I don't know, but we know it's getting into the kids' hands. And could we completely prevent it? No, but every town that takes a measure to keep it out of the kids' hands, it makes it a little bit harder to get. And if it's harder to get, we can get better results. And I think that's the end result. And to your point, you know, in defense of your clients, these people are part of our family. The retailers in the town of Ashland are significant to us as citizens. The revenues that they generate aren't only providing their incomes, they're providing revenues to our town to keep it alive. We do have a vested interest in your businesses. We're not trying to put you out of business or to take food out of your mouth or out of your family's mouths. We're not. We're just simply suggesting that a portion of the revenue that you're generating is damaging our youth and your youth. And maybe creatively we can come together and find a solution to replace that revenue with something that can make us a healthier community instead of a sicker one.
Chris, well said.
Thank you.
Nice job.
If I may just directly address, you raise a great point. People have referred to it as leakage. So you have retailers, maybe they're selling it to adults. Maybe that adult is then passing it off to someone who's under 21. Or maybe a child has a fake ID and he's getting away with he or she's getting away with purchasing that e-cigarette product or the combustible Marlboro. But again, just to provide you with some additional data on my end, the FDA 2017 and CDC provided that 85.5% of the youth who admitted to using the e-cigarettes, those children said they did not get them from retail stores. So that leaves open that they're getting them online or getting them from other means. But I'm not making up the statistic. They are telling you that they're not getting it from the retail stores. Now, whether or not they're lying, I can't tell you that. So.
Anything else? You know, I just want to thank you. I've been doing this a long time, and you know, no matter what side of the argument you come down on, you've handled this with class and with dignity, and you've represented your clients well, and you've been a pleasure to work with. We don't often see that in a contested argument like this, so I want to thank you, and I think the board can back it up that you've been a pleasure to work with, and you've represented your clients well, and I thank you for that. And I think it's important in today's political climate that we can disagree, but we can still work together towards a more common goal. And that leads me to my first question. You bring up the task force, and I've always thought that was a good idea. Have any of the other communities that you've represented have they developed a task force or anything?
No, not since I got involved in October.
Okay. And is it because nobody thought it was a good idea, or it just never really got picked up on?
I think it's a combination of boards are being told it's a tobacco industry tactic. I don't represent the tobacco industry. Second, I have retailers who are more than willing to sit down and do this and actually talk about their experiences. I don't know. I honestly can't tell you, just other than it hasn't been pursued by boards.
And this might not be a fair question to an attorney, but a public, your words, and if I misspeak, please correct me, banning all tobacco products would be a public health decision.
I think it would be better argued as a public health decision as to taking a less dangerous product off the shelf versus a more dangerous product off the shelf.
And as attorney who represents the tobacco retailers, what would the chances of us not being sued for that be?
I can't answer that question. Because
I
right
think you
now,
just
no
did.
one's come to me to, you know, I'm
Right.
only right now dealing
Right.
with Somerville.
Okay. Okay. All right. Well, thank you. Thank you. Like I said, I hope you stay for the rest of the conversation. And, you know, tonight, that's all we're doing is having a conversation. So thank you.
Thank you for listening.
Thank you.
Appreciate it.
All right, so we'll start taking comment from any and all retailers. Anybody here who will have an opportunity to speak. Like I said, just make sure you come up and identify yourself for the public record, and we'll go from there. And if you want to form a line so we can kind of, you know, figure out what the,
Do you just want retailers or the other
no,
people?
anybody here?
Anybody, okay, you said
anybody's here.
retailers.
Anybody's here can speak. Good evening, sir.
Good evening, Mr. Chairman, members of the board. Thank you for inviting us to tonight's meeting. William Goldberg, Main Street Wine and Spirits, downtown Ashland. Forgive me if I don't look up. I'm not used to talking in front of people. I'll do the best I can reading from what I have here. I am not here to argue for smoking any tobacco product. It is gross and unhealthy, if not outright deadly. We all know this. Choosing to smoke is bad, but as long as there are people, there will be people making bad choices. Tonight, I am here to comment only on how this town banning one style of an entire product will affect my business. And I do think it is important to keep in mind how it will affect businesses. Currently, menthol cigarettes comprise 20% of my total cigarette sales. If a ban were enacted, the immediate effect would be that I directly lose those sales. But all of those smokers will still be able to go to any other municipality to make that purchase. That means menthol smokers who come into my store would cease to do so, and thus a secondary effect will be that I will lose sales of complementary items as well, which would compound the loss of business. Less business means less revenue, and less revenue will make it more difficult to keep my shelves filled with product and more difficult to keep up with increasing labor costs that were mandated this year and will continue to increase each of the next 4 years. I read last week that a Needham Board of Health member who, commenting on his town's ban, declared that he didn't know of any store going out of business because of a flavor ban. I ask you, is putting a store out of business the litmus test for regulatory action? As I said earlier, smoking is a bad choice, but I plead with you not to single out and punish the town's tobacco retailers for the bad but legal decisions of those who live and work and shop in the town. Enacting this regulation will hurt Ashland businesses and will send a clear message to others that the town of Ashland is not a business-friendly town. I reticently applauded the proactive move to increase the minimum age to 21, and I am glad it is now statewide. Now the playing field is even for all retailers. No one town's businesses have an unfair advantage over another town's. That's how government should affect business. If the goal is to prevent minors from smoking, isn't the minimum age accomplishing this? To conclude, banning the sale of menthol tobacco products while other municipalities all around Ashland and in the state still allow it will do nothing more than hurt Ashland tobacco retailers. I urge you to take one of the following actions. Do nothing now and wait for the FDA to act on a sweeping nationwide move that is under consideration. Or 2, meet, discuss, and plan with other municipal boards of health to petition the Massachusetts legislature to act with a uniform and simultaneous statewide change in law. Or be courageous, stand by your convictions about smoking, and move to completely ban the sale of all tobacco and nicotine delivery devices throughout the town. Thank you for granting me this time to speak.
Thank you.
Thank you.
18 in 12.9
Excuse
square
me,
miles.
you have to identify yourself
Oh,
and your
sorry.
address.
Hi, I'm Neha Shabir. I'm a senior at Ashland High School, and you have to know my address as well?
Just your street. You don't have to give your
Okay.
street.
Tyler Lane.
Thank you.
Okay. 18 in 12.9 square miles. That's the number of access points for buying menthol, mint, and wintergreen tobacco and e-cigarette products in Ashland. 18 in 12.9 square miles of Ashland. That is more than one retailer of addictive flavored nicotine products per square mile. My name is Neha Shabir, and I'm a senior at Ashland High School. I'm in support of the Board of Health's proposed ban of menthol, mint, and wintergreen tobacco and e-cigarettes, as well as draft regulations of retiring licenses in Ashland. I've seen my peers jittery in class due to nicotine cravings. I've seen my peers' grades suffering because they miss class time to go vape in the bathroom during every single class period. I have seen my peers pressured to look cool and destroy their health because it's not considered as bad as smoking. I have seen it firsthand at Ashland High School. The majority of my peers, or 51.2% of 12 to 17-year-olds who use e-cigarettes, use menthol or mint-flavored e-cigarette products. By removing the harsh smell and taste of tobacco and replacing it with candy-like flavors, youth assume these products are less harmful than traditional tobacco products when they are not. The minty flavors mask the burning and coughing side effects of smoking and make it easier to experiment with. According to the National Youth Tobacco Survey, youth who use e-cigarettes are 4 times more likely to begin smoking traditional tobacco cigarettes. According to a CBS report, in the past year alone, e-cigarette use in high schoolers has drastically increased by 78%. By allowing access to menthol, mint, and wintergreen tobacco and e-cigarette products in our town, we're standing back and watching the clock turn back to the 1950s and throwing away years of advocacy and products about the harms of tobacco. It is the Board of Health's duty to implement policies that protect citizens from dangerous public health hazards and epidemics, which is what this is. In June 2018, San Francisco voted on banning all flavored tobacco products and fruity e-cigarette liquids. As the chairman mentioned earlier, in Massachusetts, Somerville was the first town to pass a ban on menthol, mint, and wintergreen tobacco and e-cigarettes, and Needham followed in suit, passing the ban last week. So why wait until it's too late and more kids are addicted? Ashland should be a leader and start protecting its youth now. Thank you.
Thank you.
Wait, can I ask you a question? Sorry. So in your I'm sorry, I have a cold as well. In your discussion, you were saying that your peers in school are using e-cigarettes.
Yeah, they're using
How many
vapes.
of them are smoking cigarettes? Are they all using e-cigarettes?
I don't know for sure how many of them are smoking traditional cigarettes, but the majority do vape and use e-cigarettes. Yes.
And I don't know if you can say it, but how are they getting it? So because I would give the vendors that are here credit that they're not selling to anybody under the age of 21. So we're discussing this tonight, but how are they getting it if they're not going into a convenience store to purchase it or a grocery store to purchase it? They're getting it from someplace else and not at our local vendors.
I wouldn't know from personal experience, obviously, but
Oh, you seem
but
very
yeah.
knowledgeable. I thought you might have some information.
Oh, you have something? This one? Okay. In 2016, 25% of AHS cigarette users said they bought them in a store in a town where they lived. And I think other students might be getting it from older siblings or people who might
People
buy from
purchasing
them
it
in
for
town.
them.
Yeah,
Okay, great, thank you.
no problem.
Just a side comment, kudos to the Ashland school system, because I couldn't have done that when I was in high school. So thank you for doing that. You did a very nice job. Good evening.
Good evening. Thank you. So my name is Sahil Muthuswamy. I'm a junior at Ashland High School. I'm also the president of Students Against Destructive Decisions. We believe that the future sale of tobacco and nicotine products with menthol, mint, and e-cigarette variations is wrong and devastating towards the youth of our community. The vibrant flavors such as mint, wintergreen, and menthol are an obvious attraction to the youth of Ashland High School. Menthol and mint flavors the mask and the harshness of the smoke and tobacco taste. It can also cause users to inhale more deeply and become more dependent on nicotine. This in turn would increase the amount of addicted teens who could endanger their chances of success in careers and education. It can provoke side effects such as severe distraction, depression, anxiety, and even irritate the airways of the lungs. We understand that people under 21 aren't supposed to be able to access these products, but they can and they do. Being part of this future generation, we are taking a rigorous stand. We are absolutely against the continued use of these products. We have seen some of the effects of these e-cigarettes and vaping products with nicotine in our own school. Often students will leave classrooms to vape in the bathrooms, and we've even seen students who display the symptoms of nicotine dependence, but still believe that using these products a few times will have no harm. However, on the contrary, indulging in these obviously unhealthy habits causes them to miss vital classroom instruction and lessons which jeopardize their future. Thank you. Also, I have another statistic to add to Neha's presentation. Only 3% of Ashland High School e-cigarette users said they got them on the internet, which means they're gaining them either through friends, family, or adults, which again shows the effects of the stores on the town. Thank you.
Very nice job as well. Thank you. Good evening.
Neil Patel from 7 Pond Street, Sunnyside Liquors. Okay, so this ban that we're proposing, even if it goes through, how I see it is the kids that want to smoke will go outside the town and they will get what they want. And as a clerk, I see more adults come in than I do see kids. I see people in their 50s and 60s come in, I'd say 15, 20 to 1, compared to kids between the ages of, say, 25 and 21. And these adults, they're gonna be more affected, and that's gonna come to us in our bottom line and what we have for product available to them. They're just gonna be going out and, outside of town of Ashland, outside from the businesses that we have in our town, and they're gonna be going to other communities that will provide them what they want.
Can I ask you a follow-up question? Because I thank you for coming and saying that. The fact that you're here tonight is, people are aware of this. Have any customers commented on, feedback on this? These crazy Board of Health people, what are they thinking? Or I've got, I use e-cigarettes because I was addicted to combustible cigarettes. Have you had any feedback from any of your clientele?
I've had no feedback, but like I said, this is still just an initial discussion that we're having.
Correct.
So until something becomes more on paper, I'm not going to hear anything from them unless I start the conversation. And I don't want to start the conversation with them, because that's not a conversation I don't think they want to have. They come to our stores because it's close to them. They live in the community. If they want a product, they want to go somewhere where it's most convenient to them.
And you're right on the Framingham line, so.
Yeah.
And what percentage of, is it, and it might not be a fair question, what percentage of your business is Framingham versus Ashland, you think? Is it 50-50 or?
I don't know where everyone comes from. I know that I am a part of Ashland.
Card everybody, right?
I know I'm a part of Ashland. And the other businesses around the community, the Market Basket, the Stop and Shop, they're big draws into our community. And because of them, we're able to stay in business. Mm-hmm. And yes, and staying in business is something that we should be allowed to do. And asking of this, it seems unfair to me.
Well, thank you very much.
Thank you.
Thank you.
Hi, how's it going tonight, guys?
Good evening.
How are you?
Good, thank you.
My name is Bertina Adams. I am the store manager at Seasons Corner Market at 123 Union Street in Ashland. I have been the manager since we reopened September 2017. Since this, we have not had any issues with our age or children trying to come in and buy tobacco products. We have a strict policy at my store, and I know other locations that we have, where we require IDs. Our systems are programmed to scan IDs. We do also accept passports, but my employees are trained right from the beginning to look at IDs, check for identification, make sure it's the right person. We also have a machine that scans IDs to see if they are fake. So we try to make sure that nobody under the age of 21 is purchasing tobacco at our locations or the e-liquids. We're very strict. We start from day one. As soon as they start working for our companies, we start training them. They go through a 5-day period before they can be left alone at a register selling to customers. We have to make sure and verify that they are not selling to anybody under the age of 21. For example, I've actually had an employee who was well above the age to purchase cigarettes, but tried to purchase her own cigarettes with an expired passport. I did have to release that employee. It's very strict for our company that we do not sell to anybody under the age of 21.
Thank you.
That's good.
Thank you.
Thank you.
Hi, my name is Barbara Theron. I'm the district manager for the Ashland location on Union Street. I just want to go over what we do from the beginning when we hire somebody new for our company. So we have it's a day one class. So it's located in Waltham or in our office in Rhode Island. So that class runs for like a couple hours, 2 to 4 hours, and we go over a video of selling cigarettes to minors and what to do and examples, what happens if we do sell cigarettes to a minor. So our company policy, we have to ID everybody that's under the age of 40. In Ashland, we actually ID every single customer, no matter what the age is. Like Tina said, if a ID is fake, our computer says it. We do not have to sit there and think of the math. Our company spends thousands and thousands of dollars of technology to make sure that our employees are not selling to minors or anybody under the age of 21. So at Tina's location, our customers are very good now. They come in, they have their ID. We verify that the customer is the customer. And then on the store part, on the back end, what we do is we have a sheet that prints out every single day, and it tells us if our employees are scanning the ID or punching the date of birth in the computer. So every time they punch a date of birth in the computer, we verify that with our video. So we have 6 months of video at our store, and then we know if somebody is trying to sell cigarettes to somebody that doesn't have an ID. And if that does happen, what we do is we suspend that person and we investigate it. And right now, our compliance rate in Ashland is 100%. We have a company that comes out and does external stings too, including you guys and including the FDA. Under those circumstances, we sell cigarettes to any minors in our location. And we don't see our customers buying the Juuls or menthol cigarettes and going outside and purchasing them for a minor. Minors do get cigarettes, we know that. But at our location, if we see a second party sale, if we see a minor and they're saying, oh, grab me that Juul, we refuse that sale right away and we don't sell them to the customers.
Great policy.
That's a great,
Yeah.
sound like you're
That's
doing
it.
great. Can I just ask you,
Sure.
because you mentioned you're a district manager.
Yes.
What is your district?
I have Ashland, Framingham, Shrewsbury, the Waltham area, and then I have New Hampshire.
The reason why I ask is one of my personal, not the board's, but my personal concerns is Juuling has been very aggressive with their marketing, with signage and placements in the stores. Have you seen that with Juul? Have you had any concern? Like, Juul is, like, hey, can we put up these signs, or can we display Juul on the counters? Have you seen? Any of that?
Actually, my boss will be able to explain
Okay.
that better than I could.
Okay.
We do have a Juul sign up. We don't have, obviously in Ashland, we have a flavor ban. So the Juul mint and the Cool mint, I could tell you I'm an ex-smoker for a week only, and I went to Juul's. And right now I'm smoking mint Juuls. Hopefully I can kick that habit, but he'll be able to explain about the signage better than I could.
Okay, thank you.
Okay,
John, question.
Yeah.
sure.
On the average, how many cigarette buyers are there in a day?
So right
Roughly.
now, if we do ban menthol.
No,
oh,
without this, just right now, how many
How many
cigarette buyers
transactions?
come into your store in a day, on the average?
We sell over 100. Three-quarters of the customers buy cigarettes, and they're not only buying
Which,
cigarettes.
I just need a number of clients, roughly, who buy
So we
the
sell
cigarette.
like probably over 150 packs of cigarettes a day.
So 150 people will come there.
Yes,
Oh,
and
it's a
so they're
lot-
not just buying
It's
cigarettes.
a lot of video to scan and find out.
So not only they buy cigarettes, we have Dunkin' Donuts inside.
No, I just wanted
Yeah.
to do the cigarette buyers. That's when you check their pictures anyway.
Oh, we ID every single person that walks through our store,
Right.
including myself. I work for the company. They know me. I'm obviously over the age of 21, and I cannot purchase cigarettes in that store unless I show an ID.
That's good.
Can I ask you another question?
Sure.
And it's a personal question.
Sure.
So, you don't have to answer it. But
That's okay.
hypothetically, we banned mint. What would you do?
Tell you to be honest with you,
Please.
I would go somewhere else and buy cigarettes. I mean, the mint Juuls.
I appreciate
Yep.
I appreciate that.
If I may, John. I want to say thank you to you and to your company for being so open about the process you use to restrict the sale and be compliant.
Yes.
And I do also want to say, though, that that's not in question here. To all of our retailers of cigarettes, you have all been really good about compliance. Why do we know that? Because we're pretty hard on you when you're not.
Yep.
And we have our compliance officers here with us tonight. So we appreciate very, very much that you take those extra precautions
Thank you.
to not sell cigarettes to to people that are under 21. What we don't have control over, and what unfortunately you don't have control over, is when, say, a 22-year-old kid who didn't go to college is trying to make an extra buck and comes into your store and all the other stores, buys 2 or 3 packs of this, 2 or 3 Juuls, and then goes into the parking lot of the high school and sells them to the kids. I don't know that that's happening specifically.
But we
it's
do
a
have a
hypothetical.
limit, excuse me, we do have a limit of how many Juuls a customer can buy per day in our store.
And that's,
we
again,
actually have that on our sign, right in front of the Juuls.
That's
in
fantastic.
every one of our locations.
It's fantastic.
And how many is that?
That's 5.
5.
That's still
Yeah,
quite
no
a bit,
more than
but
5 in
better
one day.
better than unlimited. But the main point that I'm trying to make is as good as you all are at compliance, they're still getting into the kids' hands. We heard right from the high school kids themselves. And that's the problem that we're trying to address.
Okay.
Great presentation.
Thank you.
Thank you.
Hello, my name is DJ Orr. I live in Massachusetts, Wilbraham actually, and I am the Director of Operations for Cobia. My peers spoke before me. I'm here to only talk on a few different points. One is the question keeps going back to how do you keep the cigarettes and the vaping out of our kids' hands? The first order of business, I would think, from us being here and speaking to this, is that we don't have the answer for that, okay? I'm honestly telling you, I'm a father of 2. I've lived my whole life in Massachusetts, and I have never smoked myself. My kids, thank God, do not smoke, do not vape. My peers, unfortunately, I'm always on their case about smoking on their own part. I'm against tobacco smoking as a personal choice. But in the convenience store industry, which I represent and have worked for 30 years, I can honestly tell you companies such as ourselves spend a lot of time, a lot of effort, and a lot of energy. And to your point that you made very eloquently, you guys are right on our back always to make sure that we comply. You seem very convinced, and I appreciate that we are trying to do the best job we can. Do we always, 100% all the time, succeed? No. No, we make mistakes. We have employees that make mistakes. When we have those, we deal with them harshly. Okay, they lose their job more times than not. So how do you keep the underage smoking away from, this I'm sorry,
Epidemic.
I'm not epidemics, thank you very much. New tongue, right? And I don't even have a cold to
I know.
go off of it. So, but
Stick around, you'll get one.
how do you do this? Well, Massachusetts is 1 out of 5 states that do not, if I have my 15-year-old kid who opens a pack of cigarettes at school, the only harm that comes to them, the only penalty is whatever the school system has in play. We allow our children to smoke in public. The police and many of the teachers do not have the tools by law in Massachusetts to go in after that. I would say, from being a retailer, that is the direction that we should be looking at as a community, okay? Blaming the convenience store retailer for selling illegal product to legal adults, I think is, in my opinion, and I hope I don't offend anybody by this, is I would only pose the question, if you do this the day after, do we really think that we're gonna stop the kids from getting this product from all the area towns that do not have this now? So the talk about banning the entire product, the talk about working as a state and not having one town at an economic disadvantage for their retailers as opposed to another. These are all conversations I would love to join with you in a task force. The conversations about blaming the retailer for trying to do the best job it can, and again, you have the numbers. You know our fail rate and our success rate. Somewhere around a 98.8 from the last time I looked at it. from FDA and from inside the state. And I know our compliance rate in Ashland, which is 100% over the last 4 years, okay? So I'd be willing to work on solutions as far as that is concerned as a retailer. We are responsible. We understand that, our end of the responsibility. And it is a problem for us to deal with as a community. So that's all I have to say.
Can I just ask you one question, just from a practical standpoint? What would be a solution? Things seems like to me, you know, I prescribe opiates. I get shoved down my throat since the opiate crisis. I have to take a certain number of credits every single year. What's the first thing you think they tell me to do? I get reports every 3 months.
Yeah.
That says, this is how many narcotic pills you prescribe to this patient. This is where you stand in relation to your peers.
Yeah.
This is what we think you ought to do. What do they tell me? What do you think they tell me to do?
Not prescribe as many?
Right. That's exactly right. And so what's the reasoning behind that? Well, if I prescribe less, then there's going to be less leakage left over. Does that make sense to you?
Yes.
Okay, so that's what we're trying to, I think, say to you. I can't help, neither can the board, that the rest of these towns don't do it. But who's going to start? Somerville started.
Yep.
You know, now Needham started. We're not trying to put anybody out of business. I said, Chris, you know, said that very eloquently. But who's going to stop one more kid from smoking? Who's going to incur the cost when that kid starts to have lung cancer or emphysema, and then, you know, and asthma? Who pays the cost of the increased health care that all that's going to cost for all this next generation that's going to smoke? We all know it's not great. Just like, you know, banning, you know, you're probably not going to ban alcohol either. You know, there's always going to be people that abuse it. But what's your suggestion? And I love what you said, because I had that down as well, about nobody's saying that you guys aren't doing a great job, but they're getting it somehow.
Sure. So if I may, to answer the question, I would just ask you in return, you prescribe for valid reasons, right?
Correct.
And
Or at
although
least I hope
although
that.
there's an authority out there saying, you know, reduce.
Right.
All right. Does that lessen the value of who you're prescribing to? Okay. And you know, every time you're making.
I still don't know where you know, all I can do is give a reasonable amount to my patient. Now I'm down to 3 days.
Yeah.
So if I operate on a Friday,
Yeah.
that means, you know, they have it. Whenever that numbing medicine wears off, they have it Saturday, Sunday,
Sure.
and probably Monday.
Right.
And I'm probably not seeing them until Tuesday or Wednesday.
Right.
You know, I used to give them a week's worth.
Well,
you know,
I
and
think I understand your analogy.
Yeah.
You're saying, listen, you know, from your standpoint, you're prescribing a legal medicine to a legal patient in a legal way. And you're saying that there's an authority telling you that the answer to that solution is to reduce.
Well, it's a part of it. Right.
Right.
I mean, realizing that, you know, a lot of this stuff, people may get hooked on it with this, but then there's a lot of illegal stuff.
And like you, I would say that that's a valid reason and a valid option. Okay, take away all the product, but as Adam pointed out very well earlier, we're not doing that. What we're doing is saying we're taking a portion of the product and leaving, in some cases, and this I know it's debatable, but we're leaving a portion that might even be more detrimental to our kids, okay? And by so deciding that, it's and the analogy would be you have the same type of opiates, but you're providing, you know, legally one medicine over another, and you're restricting the medicine that's probably most helpful and leaving the one that's most harmful. In analogy, if that's fair, that's how I would prescribe.
But you're not allowing for the percentage of people that would say, well, you know what, the hell with it. If these flavors aren't available, I ain't doing it.
Yeah, I understand.
Yeah, okay.
The statistics that I'm aware of echoes what Adam pointed out. He had 83, I had 80%. 80% of the youth get it from family members, from people that are friends that get and purchase this legally, okay? So the question really is, if you ban it here, okay, will that stop some of the leakage? I don't know. That's a question best in your minds, okay?
But can,
And
but can I
agree
follow
that
up on that,
In
though?
a vacuum, it's not gonna. You're right. I agree with that.
Right, in a vacuum, all you're really doing is hurting the retailers that are in front of you tonight, trying to do the best job they can, trying to support the kids, the fathers, the mothers, the sons and daughters in our workplace. Now, as far as business harm, and I'm not here to talk about business harm, because you made the point earlier saying that I'm here to represent the public health, and I agree with that, okay? I'm only asking for it to be equitable, all right, across the board and fair as far as the retailers are concerned. We are business people that have been in your business for years, trying to work with you on all these issues, okay? And I think we've convinced you, at least tonight, to say that you feel we're doing our jobs out there, okay?
Very much so.
This is a legal product as far as we're concerned right now, providing it to legal adults, okay? And we're dealing with a problem that isn't really in our realm at this point in time. And we're asking you to keep that in mind and keep the fairness factor involved in this. We're trying to do everything we possibly can do. And I'm here to offer my services to say, let's go deeper. Let's go into the real solutions on what will protect our kids and our communities at this point in time. So I'm only asking for you to think of it in a holistic view as far as the retailers are trying to work with you.
And that's very fair, and I appreciate that. I think it's fair to say that I'm the only member of this board who originally took up raising the age of tobacco to 21 when we did that. And when you asked the question, I think it's a fair question, and we could debate it all night long into the midnight hour here. If you do this, does it stop? And the answer is no, and I think Cheryl Sabaro's here tonight, and I remember when we went through it, the vitriol that this board went through, and like, you guys are morons, you know, you're gonna raise the age of tobacco to 21. Well, fast forward to 2019, and I'm not saying that it's about being right, but the state said many years later, you guys were right.
Yeah.
So, and do people still underage smoke? Our compliance officers will tell you, unfortunately, yes. But to Ron's point, yeah, if we ban, and like I said, it's only a discussion, if we ban tonight, you go to Framingham, you go to Hopkinton, and you buy your product. You're right, and they still get it and they do it. But is this the first step to get to the 2019 when we do it all? And you know, and we can have a political discussion all night long as well, too. Shame on the government for putting this burden on this board, and more importantly, to the retailers. You know, this is a product that the government knows is bad, but your business depends on it because people are addicted to it.
Sure.
What weighs more? Julie Night, in my opinion, was started to help addicted smokers get off of it. But what it's become, in my opinion,
Right.
is the detriment to the youth.
Correct.
So what is more important, protecting a lifelong smoker who is struggling to get off tobacco, or protecting youth? And that's what this board gets paid the big bucks for. You know?
I'd like to also kind of piggyback on that and address something that you said, because it's really important. You used the expression earlier, blame the retailer. And if anyone on the board disagrees with me on the statement, please stop me. I don't think anyone's passing any blame on the retailer. You're in a very unfortunate position. The blame is on the tobacco companies. And now with Altria being a significant stakeholder in Juul, right, you're going to, at some point, if you already aren't, going to be in a position where they're going to say, if you don't carry this product, you can't have this product, right? It happens in the alcohol industry. Anyone that has Budweiser products in the shelves in your alcohol stores, you know that you're put in that position too, and you can't carry certain things in your freezers. And it's how supermarkets work as well. You know, shelf space is very governed and very controlled. So we do understand that. And it's really important that all of you retailers know that we're not blaming you. What we're really doing is asking you for help. And unfortunately, the byproduct of that initially is it affects the way your business operates. And we're hoping, our hope is that, again, like I said earlier, maybe we can come to a creative solution that we can find a way to replace that revenue with something that makes sense, something that makes more sense and doesn't harm our community, in our opinion.
Well, as I stated earlier, I'd be willing to work with the board and any solutions that will be fair and actually get to the problem. My only pitch, my last pitch, and then I'll sit down.
Well, no, I got one more for you. So.
Okay, maybe not my last pitch, but from my standpoint, I only ask the board to think of it in terms of fairness for the retailers who are concerned. We are trying to do the best we can, and I think we're doing a very good job at it. The companies that we represent, the companies that we work with, are spending the money and the time to make sure and guarantee, basically, because some of these companies, not all of them, but some of them are family run. They have kids themselves. My company is. The owners of this company take personal offense when they have somebody, and they have over 100 stores that they oversee. When we have a failure, they don't really care about the fines, or they just, it's the wrong thing to do for that community, okay? So we take it that seriously overall. We want to work with you, and unfortunately, sometimes it feels like we're butting heads as far as that goes. To give you a business sense, for many retailers, not across the board, for everybody, tobacco smoke in general, all tobacco products are about 50% of the overall business, all right? Menthol and mint is about 30% of that part of that business. So I'm not here to point to a business harm for us, because this is about people's health, and I understand that. But it is a detriment to every retailer here as far as business harm. So please don't take this too lightly.
I don't think anybody doesn't agree with that.
Yeah.
Can I just circle back to the question I asked your management staff? Juuling and vaping.
Yeah.
Do you display Juul or vape anywhere on a counter with access to
Absolutely
it? In any of your
we do not.
I'm not speaking to Ashland, I'm speaking globally.
We do not display anything on the counter, okay? Everything's behind our counter, out of reach of anybody, all right?
And what about signage from Juul?
Signage is kept low key, and my peer mentioned earlier that the signs are the restrictions on what we will sell to people. So,
and are you familiar with the radio ads, radio and newspaper ads that Juul is doing now?
I am, okay. And
do they use that in their marketing to promote their product with your?
Well, they are working with us right now. They're voluntarily restricted flavors on a part to kind of appease the Attorney General's office. And I applaud the work that the Attorney General is doing as far as that goes. Anything uniformed is not something that, you know, as you were having a conversation with Adam earlier, and he was, you know, at this point in time, he's looking at the nuances between, but as a retailer, doing this for a long time and dealing with multi-states, I'm interested in what the first owner came up and talked about. Do something uniform. Do it across the board at 21. And everybody is equal. And nobody has an economic disadvantage one way or another. That would be my answer. Okay.
And my last question, and thank you for all your time. You've been a great speaker on this subject. You're a parent, and you've been in the convenience store business for 30 years.
I have.
It gets back to Diane's and Chris's question earlier. How are these kids getting it if you guys aren't selling it? And you know what? You're not selling it in Ashland.
Yeah.
But they're getting it somewhere.
Yeah.
Where are they getting it?
Well, I haven't always been a Boy Scout myself.
Neither have I. Neither have I. I've bought beer, and they've had beer bought for me. At,
so in our age, it was beer and wine. And
Right.
I was able to get beer and wine, okay?
Yeah, very easily.
The laws changed, and it became much more restrictive, okay? And I understand that. I can't go to a liquor store anymore at even, you know, to put me back up to this time, and I could never get away with what I got away with back then, all right? Kids cannot get away with what they used to get away with in our retail locations anymore. However, all right, in Massachusetts, if I open a bottle of vodka at school and I start drinking it and I'm caught doing so, the police can be called and I can be charged, all right? If I open a package of cigarettes right now, I can smoke that and only am subject to whatever the school penalties are at that time, because it's that property. So, as a parent, and that's the question you posed to me, how do I reconcile all this now, being a parent now? That law particularly bothers me, because other states that hold the kids personally responsible for their actions puts a lot more tools in the teachers and in the police officers' hands, all right? And there's more of a penalty for the kids. The problem is with our kids, okay? And that's where I think the solution lays, okay? It doesn't lay at where you already have people investing a lot of time and a lot of money on the gatekeepers, that I think we're doing a pretty good job right now. Okay?
Thank you so much.
I think if nothing else, this brings awareness to our community about how serious it is about the youth, you know.
I think it's been a good discussion. Good evening.
Good evening. My name is Rihanna, and I am a student from Algonquin Regional High School in Northborough, and I'm here to talk about this issue. So,
You might have to move a little bit closer to the mic so the people at the home can hear you. Thank you.
okay. So I'm in front of you today because this summer I heard Juul advertisements on KISS 108, and it's a radio station that has many young listeners, as you know. And I was very frustrated by this, so I called the Attorney General's office, and they connected me to an organization called the 84, and they fight tobacco in Massachusetts as a group of youth. And I can personally attest to the damaging effects of e-cigarette use on youth, and I'm here to speak about the experiences of my peers in hopes that you all will support the proposal to restrict the sale of menthol products to adult-only stores in Ashland. Firstly, I want to make it a point that young people, including my peers, use menthol or mint-flavored e-cigarettes. When the FDA announced that they were stopping Juul from creating flavors other than mint and tobacco, a peer of mine said she had only ever used the mint flavor to begin with. It's very popular among youth, and that's because it tastes good. It's important to recognize that menthol and mint are flavors also because they change the taste of the original substance. Additionally, the menthol and mint flavors help differentiate e-cigarettes from cigarettes, making youth more susceptible to e-cigarette use. Currently, cigarettes have a bad connotation because of tobacco's well-known consequences on health and physical appearance. The problem is that many youth justify their use of e-cigarettes by believing that they are different or safer compared to cigarettes. They believe this because e-cigarettes do not contain tobacco. However, if youth come to associate tobacco with e-cigarettes, they will be less inclined to use them as a result of a greater association with cigarettes and the negative consequences. On another note, the e-cigarette industry often claims that youth mostly access e-cigarettes via the internet. However, many students purchase e-cigarette products from other students who are 18 years or older. Not only is this harmful to the youth, but it also gives older students opportunities to exploit their younger peers. These older students understand that the younger students will become addicted and will continue to ask for the e-cigarette products to fulfill their cravings. Additionally, I'd like to point out that if you cannot drive as a youth, you will not have access to e-cigarette and cigarette products in other towns because you can't go there. Lastly, I'm a witness to victims of e-cigarette addiction on a daily basis. At my high school, there's an ongoing problem of students smoking on campus. Yet what many do not realize is that students are smoking at school because they are addicted to e-cigarettes. It's not because they're rebellious or necessarily trying to be cool. I believe that the rise in e-cigarette addiction can be combated with preventative measures such as the one you've proposed in Ashland. I hope that if this measure passes, it will influence other towns in the state to consider this proposal as well. Thank you for your time.
Very nice job.
And if I can ask you a question, just again, even playing field is, you know, one of the women had said that she used to smoke cigarettes and now she's using a flavored e-cigarette. Now, do you think that the peers that you see, if we eliminate mint flavored, that they would go to regular tobacco flavored? Or do you think they wouldn't smoke at all?
I think they wouldn't smoke at all.
Okay.
So there are mango and creme brulee flavors in tobacco that Juul has, and I've heard from peers that mango and creme brulee taste horrible, and tobacco has a connotation with cigarettes because it has tobacco in it, whereas Juul products don't. So I think, yes, they wouldn't go to that, and I think they're attracted to the mint flavor because it tastes good.
Thank you.
Yep.
Hi,
Hi, good evening. My name is Carly Caminetti. I am the program manager for the 84 movement, which Rihanna just mentioned. So I work for an organization called Health Resources in Action, which is funded, my program that I run is funded by the Massachusetts Tobacco Cessation and Prevention Program as a part of the Department of Public Health. So I just kind of wanted to explain a little bit about what the 84 is. So the 84 works with high schools all across the state and also community-based organizations like YMCAs and Boys and Girls Clubs. And we talk to young people about their experiences with tobacco. So Rihanna is a perfect example of somebody who was enraged about this issue, called the Attorney General's office and got connected with our program. Really, the data from the YRBS in 2017 says that 20.1% of high school students vape at this point in the last 30 days, which is just absolutely absurd compared to compared to other years, and compared to the fact that cigarette use has been going down over the last many years. So the 84 youth work to educate their peers and others in the community about tobacco issues, and I'm hopeful that the youth that you saw today will also be involved in our program. As part of our program, we had a big event in October called the Youth Power Summit, where we focused on training young people about tobacco issues and hearing from them as well. And menthol was a huge issue that we spoke about. So in our opening session, we asked the 150 youth that were there how many of them thought that menthol was a flavor, and all of them raised their hands. Whenever I go and do trainings with young people in high schools and I talk to them about menthol, they just don't even understand why menthol isn't included in a flavor restriction in the first place. It's like it doesn't compute to them. Like, well, why wouldn't menthol be considered a flavor? It's a flavor. If you ask anyone if mint is a flavor, it's a flavor. So the impact on this on young people is huge. As Rihanna mentioned, the amount of young people that are using mint products is astronomical. I too have seen many and had many school administrators contact me and send me pictures of what they're confiscating in their schools, and there are many green items in those pictures. So somebody here mentioned about the opiate epidemic being the largest epidemic, but I would like to counter that by saying tobacco is and has been and will probably continue to be the #1 epidemic that kills people. Now throw vaping into that too, and we're talking about high school students that are completely addicted, and it is a dire situation. So yes, I can understand the arguments of the retailers here, but I also wonder what it would be like to live in a world where retailers actually stood up for health and listened to the voices of the young people who are experiencing this in their schools each and every day with their peers who need to go take breaks to use these products, and come up with a solution. Can we sell something in these stores that is enticing to people who actually care about their health, like fruit or vegetables? Is that too far of an idea to think of when it comes to alternative solutions of what could be sold in these stores? So, and also, you know, I mean, I frequent convenience stores all the time, and the amount of advertisements that are plastered on the outside of these retailers' windows, you can barely see inside. And a lot of those include, you know, $15 off for Juul coupons, or other tobacco products that are mint and wintergreen that are on the outside of their windows. And young people are the ones who notice those. Adults don't notice it. I notice it because it's my job to look for these kinds of things, but young people, if you ask any of them, they see them and notice them all the time. So what would it be like for all these retailers in town to take down all of their advertisements from tobacco at the outside of their windows and replace those with health messaging instead? So I'd just like to say thank you for your time. I think that Ashland does need to be a leader in this, and we better get on the bandwagon now because this train is moving and it's moving fast. Thank you. Any questions?
Any questions? I just have one, and only because your job is to work with kids every day. When you run into I don't even call it a kid, a young adult who is vaping, the conversation is, why do you vape? Why do they vape? Is it because it was marketed to them? Because it's cool? Because it tastes good? I'm addicted? I'm a rebel? I mean, what is the common response?
Great question. So the #1 answer is flavors. And the Surgeon General has put out data that says 85% of youth 12 to 17 say that flavor is the #1 reason that they use. I think too, I'm glad you brought this up because oftentimes we as adults refer to these youth as kids, and they're so much more than that. They are so smart, they're so articulate, they understand what's happening, and it's unfortunate that the marketing has led them to use the product. The problem is not the kids, as somebody stated earlier. The problem is the industry, and the problem is the marketing that the industry has done in order to hook the young people. So we need to take out of our language saying things like, you know, a lot of times people will say, oh, the kids will get their hands on the products. It's not about that, and we shouldn't be blaming young people. We should be looking at the source of the problem, which is the industry. And in this case, what can we do to restrict the industry? Exactly what you're looking at right here. So we need to not put the blame on the youth. All this stuff about punishing the youth or criminalizing possession, all of that is a bunch of baloney, and it really shouldn't be considered at all. When we talk to school administrators about it, like if they're calling us saying, what can we do? And they're saying that they're suspending their students, we strongly advise against that. If people are going to be suspended for the use of a product that they're addicted to, they're missing school, which is not good for any young person. I've heard of a school that suspends youth up to 10 days. So what are they going to be doing at home? That's not going to get to the cause of the addiction. So again, like it's not the young people that are the problem. It's the industry, and we need to at least do what we can in our power, and in your case, in a Board of Health situation, and stand up for health.
And if I could just say, because I might be the only one sitting up here that is against what we're proposing tonight.
Mhm.
I'm not in favor of it, because I think most of the conversation, not all, but most of the conversation that we've all had collectively tonight is about e-cigarettes. And I think we all know that is an issue for youth. But if there wasn't the e-cigarettes, we're not talking about menthol cigarettes. I mean, nobody's talking about, oh, I'm having a youth are out there smoking menthol cigarettes on the side of the road. It's most of this is about the e-cigarettes. So the industry is targeting the kids with the e-cigarettes. So what my issue is that you need to be 21 years of age to purchase tobacco products. You clearly have gotten everybody's message that this is a very serious issue. They should not be getting tobacco products in the town of Ashland under the age of 21, period. So no matter, I mean, you know, people, you know, we can laugh. Yes, I'm not directing anything directly at you, but people can laugh, but that's my opinion, and I'm pretty firm about it.
So
Because well, exactly, if somebody said, well, some kids like peppermint schnapps, are we gonna ban peppermint schnapps?
You can't go to
You have to be 21 years of age to purchase it. We need to educate those people who are going to the convenience stores and purchasing 5 e-cigarettes in a day. I hope they're not smoking 5 e-cigarettes. Clearly, if you're buying 5 in a day, I'm hoping it's not for that one person who's purchasing it. Maybe that's an example.
Could I respond?
Absolutely.
So first of all, on the e-cigarette point, if they're buying 5 in a day, each of the 5 that they're buying contains 4 pods, so that's actually 20. So 20
clearly
packs
they're purchasing them for someone else.
So I'm not, you know, I'm not here to talk about certain stores' regulations, but in terms of the actual menthol cigarettes, if I could speak to that a second, I have statistics here from Campaign for Tobacco-Free Kids. Young smokers are more likely to use menthol cigarettes than any other age group. So that's over half, which is 54% of youth smokers aged 12 to 17 use menthol cigarettes, compared to less than 1/3 of smokers aged 35 and older. And then prevalence of menthol use is even higher in African American youth. That's 7 out of 10 African American youth smokers smoke menthol cigarettes. I'm sorry I didn't bring the race issue into it, but I most certainly would like to now. It is a race issue, and the tobacco industry has been targeting people of color, and especially the African American community, but also LGBTQ community, women, other minority groups that they have targeted with menthol cigarettes in particular, which is why all of these statistics are so much higher for the African American community and the other groups specifically. You're right that it hasn't been brought up, and I would say
discussed it as a board.
And I would say too, as a white person, you know, these are things that we need to be looking at. This is not it's not a mistake that it hasn't been brought up, right? Like we really do need to take a look at this from our white perspective and say, well, why are we not talking about this? This is a race issue, and these people have been oppressed since the beginning of time, since the slave trade, and people of color have been oppressed through menthol cigarettes.
Being in the industry, and again, you know, working with all these children, you must have an idea where they're getting them. Do you think it's from them purchasing, somebody else purchasing 5 at a store? I mean, I think we could, because from my perspective, I think we all have the same goal. It's just maybe, my opinion is the way that they're approaching it might not be the solution or the immediate solution, but I think we're sending a clear message, and I think a task force would be very helpful, because then collectively we can say, okay, we may not do, again, it's my opinion, we may not do this ban, but we may do something else. And I don't know, because we haven't talked about it.
Right.
Maybe we say there is a limit. You can only purchase 1 e-cigarette or something to that nature. I don't know if we have the power to do that as well.
Sure. Yeah, and with all due respect, I do feel like a task force is not necessary. I think that there's plenty of evidence that points in the direction of where this town should go. And as far as your question about where youth are getting it, I also think that that's a misguided question. I don't think that that is really important where youth are getting it. The proof is in the data and the statistics of people who are using it. And when you look at 7 out of 10 youth, African American smokers that are using mentholated products, I mean, to me, that says that is an issue. And then you think, okay, well, what can we do about it? So I
think we could go all night talking about this, especially us, because I do think it's an issue, because we have our vendors here that we're saying to them, we're going to eliminate you selling a product because our purpose is to keep it out of youth.
Mm-hmm.
Their purpose is the same, I hope.
To sell it legally, yeah.
To sell it properly.
Right.
And
Legally.
they're in compliance with what our regulations are now. So if there's establishments that are here that are allowing people to purchase multiple products, which is getting into youth, that's concerning to me. I didn't know, because I don't smoke, and I've never purchased an e-cigarette. I didn't know there was a limit on them.
Yeah.
But I think we're all absolutely on the same page of what the end result is.
I think
So
that that
I just want to bring it back
sorry,
a point of order. KG's been waiting patiently
Yeah.
for the question, so
KJ.
please go ahead.
But
And then
you
Chris.
just read some data for us, and I'll appreciate if you can send those
Absolutely.
information
Sure.
with the sources of those information, where they came from.
Yeah.
That's important.
Absolutely.
You can send it by email to Mark or
Campaign for Tobacco-Free Kids and Truth Initiative,
Sure.
which are major.
Yeah, but you can send
You
an
can send
email
that
to-
right to,
so that will be on the record, as well as it'll
Mark
be
will give
helpful
you a
for us
copy.
to study more.
Will do.
and then Chris, you have one question?
Well, it's not even so much a
Oh.
question as a comment, really,
Sure.
and I think it kind of addresses what you're asking. You know, when we talk about where are they getting it, you know, in terms of age, the reality on a broad scale is they're getting it from the supply chain. Whatever the supply chain is, right? Part of the supply chain is that the products are on retailer shelves, right? And if we can enact some regulation by taking it off the retailer shelves, we help cripple the supply chain and make it harder to get.
Good point. Now, I just want to do a point of order. We're here as long as it takes tonight, but it is getting to be a little bit late. And I know everybody in line, and I probably know where they're going to come. If you want to speak on the subject, it would be nice, so I can gauge kind of how to run the clock here. If you want to speak, it would be nice if you could get in line and or show a hand that you want to speak, so I can kind of gauge. Okay,
I
we've
think
got
did we-
one, we've got two.
3, 4.
No, we're not voting. Right.
Well, 8.
So we got about 8 to 10. Okay, and and if somebody changes their mind too, I just want to kind of gauge the conversation, because I appreciate the dialogue and I appreciate the conversation, but I also want to respect people's time as well. So, anything further?
So just to close on that question, so I think that we need to focus on the fact that however they're getting them, they're going to get them regardless. So if there are people who are selling them, then that's a whole other issue, and that's not something that I feel like you all need to take into consideration. I think protecting the young people in this town is number one. And like Rihanna said, which I thought was a brilliant point, if you have young people who don't have cars or don't have licenses to go to neighboring towns, and then you know that you're going to be protecting them, isn't that enough? Isn't that enough to know that you're preventing some addiction? That's all. Thank you.
Thank you so much.
Hi, my name is DJ Wilson. I have 2 handouts.
And DJ, we all know you, but for the public, thank you.
I am the Tobacco Control Director at Mass Municipal Association.
Thank you.
The first handout, one of the drafts I saw had handwritten notes questioning whether or not the fines should say maximum allowed by state law. So that single-page handout that I give you talks about how your non-criminal disposition is actually pretty strong in this town, and that you're at a flat 300 fine, which is really good compared to what a lot of other cities and towns have. And it talks about why using that phrase wouldn't be helpful. So that's separate from what your main purpose for tonight is. So for tonight, I do want to I gave you a second handout that talks about a lot of the topic.
Can I just interrupt you just for 1 second? I think we had this discussion about the fines, but our town meeting adopted 100, 200, and 300. That's why that was brought up. So.
Actually, on the top is the bylaw that says the flat 300 is allowed.
Correct, but that's not what the town of Ashland adopted at town meeting, the non-criminal disposition. That's, we had at our last meeting, we discussed the fines.
When was that last updated? Because that was 2015, I believe, or 2017. It says the date on it.
Yeah, that's a bylaw.
It's just to give you an idea that your non-crim should match your fines, and so.
If our regulations get posted as a bylaw, then we're okay. I'll check into that.
Well, no, so what happens is your regulation fines have to match a authorization from town meeting.
Correct.
And the latest one I could find online today was a flat 300, so you are matching right now.
That was our tobacco regulations, but we determined that that was done incorrectly because town meeting only adopted the 100, 200, and 300. That's what we talked about at the last meeting.
2015?
So we have to change our violations to 100, 200, and 300.
Double check with that,
or
because the
double check.
bylaws
I
are
think
looked
we
at.
got it.
Actually,
Double check with that.
the edits that we have in the current draft were to change the language to remove the dollar values and simply state maximum allowed by law.
Right, but that's why the dollar values are better. It just allows retailers to know exactly what the fines are. And non-criminal disposition, state law requires a definitive dollar amount.
Well, I think it's, I appreciate,
Yeah.
So, Mark, you're tasked with
Okay.
cleaning that up. Thank you. Thank you.
Maybe it's okay. We'll
Right.
see.
Well, good, thank you.
So on this subject, I gave you a second handout, and the second handout talks about explains our side of a lot of the issues that came up from the opposition tonight. And you can read that at your leisure. I should also note that this discussion tonight has called this a ban throughout, and it's really not a ban, it's a restriction. Your current language, and if you were to adopt and include the menthol into that language, it's a restriction that a current business in the town of Ashland could change their business plan and become a retail tobacco store and choose to sell flavored products. So it's a restriction, not a ban. That is a big difference.
Can I stop you there?
Yeah.
Just dig down a little bit deeper on that. Say it again, because.
So, going back in time, when Providence passed a city ordinance that limited flavors to adult-only retail tobacco stores and smoking bars, what we call smoking bars, so they call it cigar bars, that got challenged in federal court. Providence won that case, and that allowed us, because we share the same federal court district in Massachusetts, to follow that to the letter, or closely to the letter, to avoid another lawsuit. And so we've always allowed that exemption. What you're doing right now is contemplating going beyond the Providence lawsuit, but because that Providence lawsuit also exempted menthol, mint, and wintergreen.
Okay, thank you.
So it's a restriction still. You're not getting rid of that allowable exemption for retail tobacco stores. Though you may not have any right now, you're still allowing an opportunity for that to happen.
Right, and they're allowing for adult retail stores, you would have to be 21 to enter that store,
Yes,
and
and
therefore they're allowed to sell.
And there's other conditions placed upon
Right,
that as
but
well.
that, in general, they would be allowed to sell those.
Now, I
products.
should say, in the future, we may have a city or town that decides to get rid of those. I don't know. So that's, then I want to talk about, historically in Massachusetts, I can't remember the year, but I want to say 8 to 9 years ago, the town of Westminster, the Board of Health entertained banning the sale of tobacco products altogether.
That's right, I remember.
They withdrew that because the tobacco industry strongly made it clear that they were going to sue them and sue them as hard as they could. So the idea of getting rid of tobacco fell through in Westminster. Then a few years later, we had the Providence case happen. The tobacco industry sued in federal court. And now the tobacco industry basically is suing Somerville because they don't want Somerville to include menthol or limit where e-cigarettes can be sold. So this is a pattern that happens all the time. And they say, our hands are tied, but if you would just do the right thing and do it at the federal level or the state level or do it all, But at every single level, they will fight this as well, because what it comes down to, the tobacco industry has one goal: sell more product. And in the time that we've been doing tobacco control, and Ashland's been doing it since day one with the state's program, we have seen almost every policy you've put in place or we've put in place statewide has been to sell less product. Making restaurants smoke-free. 2 weeks ago, saying no vaping in this room. That means less vape is sold. Getting rid of vending machines, fewer products are sold. And so everything that we do in public health results in less sales. It's just going to happen, and we want that to happen. We want to see it go down. We want to see pharmacies not sell. That means Philip Morris makes less money when every Walgreens had to give up their cigarettes December 31st. So it is this funny banging of heads that we have all the time. But we have an industry over here that's making sure that the retailers make good money off their product, so they will be a natural ally when public health tries to do the right thing. And so, and right now we have public health doing the right thing, or aiming to do the right thing, because we've had all this outside media, and some people have talked about it already. We have the FDA commissioner, Surgeon General, the FBI raids Juul's offices. Then after the raid, Philip Morris buys 30%. I mean, so we really do see that there's just a continuation of the tobacco industry going way back from the days when we were having smoke-free sections in restaurants to today. It's no different. They're trying to protect their market as much as possible. Thank you.
KG?
No, I got my answer for the question. Fine.
I'm good.
I have a hypothetical question. Westminster kind of got scared by the tobacco industry, but okay. I'm a bring it kind of guy, So the tobacco industry is going to come and is going to sue this board in this town. What does that mean?
For the...
What does that mean? Sounds good.
For this,
Sounds
for
exciting.
menthol or for...
No,
anything.
For the whole thing?
Anything.
Oh.
So they're going to sue us. The own industry who puts on their own packaging, this isn't good for you, is going to come and sue a town for doing the right thing. So what does that mean? Because, it's going to get the headlines and it's going to get the news trucks are going to be out here, but okay.
Well, it chills state and local action, not only in Massachusetts, but throughout the country. It shows that, they mean business.
Is it financial? Are they going to, they're going to have to prove that their industry's been hurt, because it's already been said tonight, if we ban it here, they're just going to go to Framingham and
They won't say that business is being hurt, but they will say that it violates, putting product behind hiding product violates their First Amendment rights. Interstate commerce is adversely affected. There's certainly a number of legal lines that they can follow on this. And, certainly they came up with about 4 or 5 of them in that Providence lawsuit. First Amendment was one of them.
The First
Right,
Amendment.
it was beyond the board's jurisdiction.
Because part of the Providence case was, Providence said no redemption of coupons. The industry came and said, you're violating our First Amendment rights. The court came back and basically said, and I'm wickedly paraphrasing, you can drop the coupons from a helicopter, we don't care, but you can't redeem them. So you're still protecting your First Amendment rights by dropping them from a helicopter.
And I only asked that question because it was a topic that this board supported but did not initiate. In this town this past year, we banned, and I agree with you, I don't like that word ban, but we banned plastic bags. Well, the plastic industry didn't come after us and say, hey, you're affecting our business.
Right.
But essentially you did. So is it saber rattling, or is this really a public health issue that the tobacco industry, just hypothetically, would want to fight?
It's both.
Okay.
They really, keep it in the San Francisco example that was brought up earlier. San Francisco did go a lot further. They basically did the Providence language which you currently have, but they included menthol and got rid of those exemptions. So vape shops are shutting down in San Francisco. The tobacco industry did not sue, but Philip Morris funded a referendum question to the tune of about $12 million. It failed them, but they saw that it was worth $12 million to make sure that these flavors kept on being sold in the city of San Francisco. And as a note to everybody around the country, that would this will happen to you. It failed them miserably.
Thank you.
Yep.
Nope, that's the tobacco industry call. Jesus.
Hello. For the record, I'm Dr. Lester Hartman, pediatrician for 32 years. I have my MPH from the Harvard School of Public Health in 2011. I was on the floor of the Senate of the House when they passed Tobacco 21, and I'd been to 170 Board of Health meetings, and Dr. Winnickoff and I had a standing ovation from the House when this happened. And we both were in tears. Because we're here for the kids. We're not making any money from this at all. And I also just want to start out by saying, you have a lawyer that will do this pro bono. The lawyer's name, and I have sent it already to Mr. Oram through your Sherburne, and I sent it to one other person on the board. Also, his email.
Can I just stop you there? We'll do what pro bono?
Represent you in a lawsuit.
Well, we haven't been sued yet. So.
Yeah, but
right.
if you were, they
Yeah.
would, as long as the restriction was the same as Needham, okay? You followed the Needham, they would cover you. This is the Public Health Advocacy Institute at Northeastern, okay? Madam Vice Chair, I need to ask you very seriously, because I'm a pediatrician, and I don't care about business, and I know you do. But I don't care about business. I don't trust business, especially when 50% of their profits are through a convenience store. I've seen this in the drug rep
You have a
industry.
question for me?
Well, I will. I've seen this
Okay.
in drug rep and formula. Ask yourself this. 2 years ago, California went to 21, and they are showing some effective data now. But you know what? San Francisco said it was not enough, that kids are still getting in their hands. So they banned it from the city limits, okay? So that, my point to you is, that is obvious, that the problem, they don't feel they can trust the business, and nor does the public. And I did this same kind of referendum in Medway, you know, that they asked about 21. They said, give it to the citizens. Do you know what happened? It was almost the same percentage, 66 to 30, 33, 68 to 32 was San Francisco. It was 64 to 36 in Medway. So I found that to be kind of an ironic thing with 21. Also,
Dr. Hart, what's the question?
What's the question?
the question is, I ask you, why would that be that San Francisco would then want to get rid of all these products when they're 20?
About what
There is information, and I'm happy to submit it to you, but I ask you to think about that.
Gone back and forth, I think, a couple of times, I think.
Well, yeah,
a lot
good.
of information from
yeah.
you.
And I think there's plenty more, too.
I'm sure there
So, as far as the other things I'd like to mention to you is, where is it here? I have it. All right. As you know, Juul was rated, and as you may know, too, the nicotine concentrations in this country are much higher than in Europe. And are, in fact, those nicotine concentrations of Juul are banned in Europe, okay? And so I want to keep in mind that any comparison of studies, first of all, is with there's no young kids in the British studies, number one. And number two, there is no, the concentrations are far, far different. And does anybody here know what NICE is in Britain? This is the committee that they call the death committee, that when they get into the whole issue of regulating and the politicians here start getting into, this is the British Death Committee. Well, the interesting thing about NICE is they do not believe what the Royal College of London has said. It's in the Lancet Journal on Respiratory Medicine. They do not believe that this is a miracle thing, number one, all right? They are not convinced this is a smoking cessation product, adult smoking cessation product. Ask yourself this, too, while you're at
You
it.
referring to e-cigarettes?
Yes.
Okay.
All right, thank you for clarifying. Secondly, if you look at the website that Juul did, okay, everybody was 18, about 16 to 25 they look like. And they said they were focusing, their mission statement says they're focusing on getting people off tobacco. Well, when you have a picture of Katy Perry, who probably never smoked, holding a Juul on your Facebook page, let's reconsider the trusting of a business. And this is one thing that I've seen this in my own industry. Formulas and pharmaceuticals influencing doctors. We banned all that from my office because we don't want the undue influence of me recommending a product. The convenience stores could look at maybe looking at things. There have been grants for convenience stores to get fresh fruits and vegetables in their stores. especially in areas where you've got Lowell and Lawrence. Lowell has 72,000 people in one grocery store. All right, so versus Arlington, who has 4 grocery stores for 48,000 people. So there's a huge difference in this. And I have 2 more things that I have to look up here, and then I'll tell you. Juul is the heroin of e-cigarettes. That's not told by me, that was told by a teenager. And I've also suggested you look at Black Lung, Black Lives, about the history of menthol, all right? It's a well done through the Truth Initiative. A well-done video on menthol in the African-American population. And in fact, we had subtle threats in the Needham meeting about this being a racist issue if you don't allow menthol to remain. Of course, then we had Dr. Lauren Smith speak, who's African-American and who was the former director of the Department of Public Health. And she responded to that, how that is a fallacy, and it's hurting the black children in the community that is intentionally being targeted by them. And I know the gentlemen here that are the attorneys who have no kids are here also to represent tobacco. I sent you the convenient CRRs, the note from Professor Mark Gottlieb, the attorney who will represent you pro bono, that said basically, if you look at the CRR and where they get their funding, huge amount of it is big tobacco, and will be big vape eventually with big tobacco. And I spent 6 years getting the 21 law. Needham, where I live, turned out to be the first town in the country and maybe the world to go to 21. And that affected me because I didn't even know that till I was done with my MPH in tobacco control. And that's when I picked up the banner on this. We sent the Needham information that, and this is the whole issue, despite the surrounding towns not having a regulation for 21, there was a 3-fold reduction in use in high school within 3 years of tobacco products as compared to Wellesley, okay, as a result of this. We sent this information, and if you want it, I've got the graphs and everything, and Dr. Winikoff published a study with this. We sent this to New York City, and they thanked us because they said this was the main reason they went to 21, and they were the first major city to go to 21. So access does affect use, and especially those kids that can't get it, the 12 to 16-year-olds. Now, I want to argue about this data, and I've given this to you already. The CDC on its website uses the Truth Initiative data that says 75%, and I got to keep saying this because people don't seem to believe this, 75% of where kids get their products is from retail stores for vape products, okay? Period. I've also talked to kids that go into the back, they buy a bunch, and they go distribute in high school from a convenience store. So while the owners are saying their compliance is great, they don't know for sure. They really don't know because 4 times a year they get checked at best, which is Needham's does, and it gives huge fines. But it's still, people get it, and it's from mostly retail stores right now. So, and I have evidence on this, okay? And I want to show you one other thing about it. In the African,
one more point.
One
just
more
out
point.
of
The African American smokers, age 12 and older, 9 out of 10 of them use menthol. If we had restricted the flavors of menthol when we were starting to restrict 21, and it says here, 2011 rather, if menthol cigarettes ban had been enacted in 2011, it could have saved lives by 2050 of 320,000 people.
Is that all menthol tobacco products? Is that
Yes,
categorized them
that's
all
cigarettes,
together?
I believe, okay?
That, I'm sorry, that's just cigarettes?
I believe so. It says menthol cigarette ban. Okay?
Can you cite that source? So?
That's the Truth Initiative. And I'll give you this handout from them. And if you put that in, Truth Initiative, and you put in menthol cigarettes deaths 2050, you'll get the handout. Okay? And I may have sent that to you already.
You said,
And can you, just to back you up there, you said that our Juul is banned in Europe.
the concentrations.
Can you cite that source as well?
I can look for it, but I don't have it with me.
Send it to Mr. Orm?
Right, okay. And we are also, according to Dr. Winikoff, the 8th worst state in the country in vaping. Youth. 8th worst in youth in the country right now.
Who would be the worst?
I have no idea.
Okay.
Okay, number one. Number two, what was the other thing I was going to mention about it? Because I don't want to take any more time, but any questions, I guess I forgot.
If I may, Mr. Chair, Dr. Hartman,
Yes,
if you
sir.
want, my card should be right on the top there.
Yeah.
Just grab one, email it to that address.
Yeah, okay,
Thank
I
you.
will.
Thank you.
Good idea.
And let me ask you this. When you're getting information from me, have you asked for citations from the attorneys and from the convenience stores who are stating these things about the money? And is it from peer-reviewed journals that are not have any financial stake in it, so you can trust what's being
Getting
said?
a lot of information, which has been very valuable.
You know,
But is it peer-reviewed by a group that doesn't profit from the industry?
I think it's a fair statement, Dr. Hartman, is that we have not rushed this decision.
I know you have, which
We've done our due diligence on it. We're open-minded to any and all comments, so, we will review all, and I want to stress, all submissions.
We are considering all of the research and the quality of the research that comes with it.
Thank you.
Yes.
That's to me is the most important thing. And so the final thing I'll say is, it looks like that probably e-cigarettes may help reduce, and this is not believable by NICE, but this is the Royal College of Physicians, may reduce adult use by 15%.
Huh?
The initiation rate right now of youth is heading far beyond the 15%. Okay, and it's harder to get you off nicotine once you start than to get you on. So that's what I would say is the key point at this point, that I really don't care about adults. I'm sorry, I don't care about adults getting off tobacco. I care about our youth not getting hooked.
No, we appreciate that. Thank you, Dr. Hartman.
Thank you.
Good evening, ma'am.
Good evening. My name is Amy Turncliffe. I live on Rossi Lane. I'm a resident. So I did prepare a statement, and then I may, after listening to some of the conversation, just add a little bit. So while I do volunteer, as everybody knows, my time with the Decisions at Every Turn Coalition, I am speaking tonight as a resident, a mom, a neuroscientist, and a public health advocate. I want to thank you all really tremendously for the time and effort that you've put into creating updated regulations, considering them thoroughly, having this public forum tonight. I mean, this is how I know you all go about your job, but I do think it's really important. So I want to thank you for taking action to update the regulations and to align with science-based best practices in policy to reduce public health harms and youth use of these products. So many people have mentioned the data. That's what I do. So I have to, again, I pulled out some of those statistics. Data from the 2018 National Youth Tobacco Survey show that there were 3.6 million e-cigarette users under the age of 18. I mean, that's a lot, right? And as Neha mentioned earlier, 51% of high school students who currently use e-cigarettes use menthol or mint-flavored products, with Cool Mint being the most popular flavor among 18 to 21-year-old Juul users. According to a 2018 study, 15 to 17-year-olds have over 16 times greater odds of being current Juul users compared to those aged 25 to 34. And a January 2018 report by the National Academies of Sciences concluded there is substantial evidence that e-cigarette use increases risk of ever using combustible tobacco cigarettes among youth and young adults. So we are creating this cycle, right, of circling our youth and young adults back onto traditional
And I
tobacco.
apologize because I do have a quote. Could you just repeat what you just said? Just
Yep.
so what?
So what I said was that, if you're familiar with the National Academies of Sciences, they're kind of the premier organization that looks at all of the science and reports it back out. The National Academies of Sciences concluded, and this is from January 2018, that there is substantial evidence that e-cigarette use increases the risk of ever using combustible tobacco cigarettes among youth and young adults. And I think probably by now you know the data that more than 480,000 deaths per year are tobacco related. So I think, we're all looking to move, I think in public health, are looking to move towards fewer tobacco related deaths and not more over the long term. So further, menthol cigarettes increase youth initiation, increase nicotine, and you can even think, I think we all know menthol cough drops, right? Suppress the cough. Increase nicotine dependence and make it harder for smokers to quit. I deeply believe that we all have a shared responsibility to reduce tobacco use and ensure a new generation does not become addicted to nicotine. We can do this by prohibiting the sale of products that are appealing to youth, reducing points of access and availability, and institutionalizing policies that create community norms that prioritize health and well-being. I cannot emphasize that enough. I've said it thousands of times probably, that this isn't just about our retailers being able to sell products to 21, right? We know that they're going to get it. They do. As I think it was Sahil said earlier, from our most recent survey data, Ashland High School students said that only about 3% of e-cigarette users, current e-cigarette users, said that they were getting it online. So we know that the majority of them are not getting it online. So I think science and public health validates the need and effectiveness of these amendments. I really, I will continue to send you the data on all of that, but I fully support the board's proposed regulations to prohibit or restrict the sale of mint, wintergreen, and menthol tobacco and e-cigarettes, and to cap and retire tobacco licenses. Thank you for your attention to this very, very important public health issue.
Sean?
So I did kind of insert that information about the access.
As I said before, if you're not already sent the documentation that you read, the numbers and the citations, I'll appreciate it if you can pass it on to us.
Sure, absolutely.
Thank you, Amy. Appreciate it.
Dr. Conklin, even though I know you from living in our lovely town, you travel the state quite extensively, and you do this, and you should be commended for all of your hard work. You brought up the cap and retire licenses. Have you had those conversations in other communities with other people?
Yeah, I believe at least.
Because I think it's an interesting topic.
Yeah, so I know, I don't.
Natick.
Yeah, I was going to say at least Natick, and I don't know how many other communities are moving towards the cap and retire. Maybe Mr. Wilson knows, but
possibly Sudbury.
But I know for sure we were in a meeting looking specifically a steering committee meeting to reduce youth vaping in the region, and Mr. Orm was there with me. And Natick has already inserted the language to retire licenses.
They've inserted the language.
It's already, it's done.
Can we get that language?
I think it's in.
I shared, and you put it.
It's in the regulations.
And it was
yeah.
put in
Similar to
language.
what we had discussed in the draft version.
Correct, at the last, that's correct, and it's now in your draft tobacco regulations.
I'll ask the question again. Can we get that? I want to see their. I want to.
regulations?
I want to
Sure.
take their
Yeah.
regulations and mirror it to ours. Yes.
It might be. It might be already.
Yeah. Just
Yeah.
cross our T's and dot our I's.
I
Yes.
see what you're saying.
And I may have stolen the language that I put in the draft from theirs.
He's like,
That's
full
Chris.
disclosure.
And that's okay. We call that
do that, Chris.
not reinventing the wheel.
We don't
I know.
call it steal.
Fuck
We
Sharon.
sell
Yeah.
cut and paste. Cut and paste.
We're all
Right.
friends here.
For the
No,
better health of the youth.
I don't know if you gave it already, and I apologize if you did, but like the amount of, clearly we know this is an issue for use with the e-cigarettes.
It's right
Is there a statistic out there of how many either would or do
What's the
convert over,
regulation?
I call it traditional cigarettes?
Yeah, I think that
I mean,
there.
Great.
Yeah, I was gonna say I think that actually
you have
is a statistic for that. Yeah.
Okay. I just,
Yeah.
we're gathering everything.
Yeah.
so-
No, I pulled a summary statement, but that's based on data.
Right.
Yeah.
Well, thank you for everything.
Okay. All right. Thank you.
Thank you.
Amy.
Good evening.
Good evening.
Hi.
Hi, my name is Che Patel. I'm actually a resident of Ashland, as well as I own Che's Liquors in Ashland.
Che's Liquors.
So some of you guys know me. First of all, I want to thank you guys for bringing the subject up. It's a very important one. I, as a retailer, which I do currently sell menthol cigarettes, which makes up probably about I don't know, about 20-25% of our cigarette sales. I don't want to be too repetitive tonight. A couple things that I want to bring up is that we've heard a lot of statistics tonight in regards to that, where maybe the youth are buying it, maybe, or getting it from other kids and things like that. We've heard statistics about what it does to maybe your health, and hence the reason why it's being brought up, right? Well, a couple things I want to mention. So, I'm all for the, well, actually, I'm not for the ban because I do sell it in our store, right? Fix our businesses just like but what in my opinion, you guys are trying, not you guys, but the board's looking at is essentially limiting our sales versus, like you guys said, it's other town. I mean, kids can go to some other town. But here's what I did tonight, okay? I've been sitting here since the meeting started, and I just spent $9.33, and it will arrive at my house on Thursday. So I just bought pods online on my Amazon Prime account.
Right.
So, and I believe.
Did it ask you how old you were?
It did not.
It did not.
It did not. So here's something that's very interesting, right? Most kids that are underage or are young, they're not using their own Amazon Prime account. They're using their parents' account, right? If you live in UMass Boston or UMass Amherst, you're going to Northeastern, you're going to one of the colleges, right? You're buying stuff on your parents' account all the time.
My kids do.
And it's being shipped, and no one's going to open your mail. One, because it's illegal, and two, when it arrives at your doorstep, pop it open, and there it is. You didn't have to go to a liquor store. You didn't have to go to a convenience store. You didn't have to go anywhere to get it. It just came to you. Okay, so I ask you to take that into consideration, and it may be the reason why so many young kids have it. So.
Can I just ask you a question, or any guys go first?
Well, I mean, just to your point, and yeah, you're right. That is a problem that they can buy it online. The last meeting we were here, I was on Jules' website, and it did actually ask me if I was 21 or not, but it still let me go on with the thing.
I mean, even
it's
if
a
you lie.
possibility, and it's chronic, and it goes back to the point I brought up before. It's all about the supply chain,
Right.
We can't control the whole supply chain, right? But if we affect the supply chain and limit the supply, then there's less of a chance of it getting into their hands.
So here's my contradict to that, right? Is that if you limit the supply chain, great. So there's a few less people that are doing it, right? So now you're doing menthol, mint, and spearmint. I don't know what the terminology is.
Wintergreen.
Wintergreen.
Yeah.
Okay. So what's saying from just regular smokers going over to just regular tobacco?
Regular.
Yeah. I can almost guarantee you that a guy that smokes or whoever that smokes typically a menthol, and he's at or he or she is at my shop, and doesn't want to go anywhere else to get it, then I'm like, you know what? I'll just take that. I have it all the time.
And you're right.
And I have things that I'm out of stock of sometimes because I didn't get my delivery yet or something, and boom, they'll just buy another version of it.
You're right. They will.
Okay.
I might disagree.
But even if they will, right? The child who might have his very first inhalation of a nicotine product, right? If it's not menthol, there's less of a chance that they will get hooked on it. That's statistically, the numbers show that.
Okay, but I guess I'm looking at the bigger picture here.
Yeah.
The bigger picture is that you guys have identified that there's a larger issue with our youth, right? There's a larger issue with more and more kids that are just having the availability, right? Our compliance rate, I don't know what it is, but for the years that I've been in business, knock on wood, we've never had any issues, and everybody in my store comes as an adult. The only thing you come in my store to buy is maybe a bag of Skittles and a bottle of water.
But let me ask you this, and it might not be fair, and I've known you for a long, long time,
Yes.
and you and I have done
Yes.
business over the years, and I want to ask you two different business questions. But first, I want to say, I'll tell you how my Friday night went. In my basement, in my house, a 20-year-old Georgetown law student, a 19-year-old Harvard student, a 19-year-old Quinnipiac University student, and a Mass Bay Community College student were in my basement. And Mr. Featherston, we saw on Facebook that you want to ban juuling. Okay, well, that's not even close to being true, but let's have the conversation. Well, we saw it on Facebook. It has to be true. Well, all right, so we'll talk about it. And the conversation really delved down into what you said earlier. If we ban vaping products in Ashland. Kids will just go to cigarettes. And that's the question that I asked of all of these much smarter young adults than I. I said, so if we did ban it, would you guys go to cigarettes? And across the board, the answer was, no, smoking's gross. I said, well, then why would you vape? Because vaping's cool.
It's a fad, it's a technology thing.
It's a technology thing, and it's a game for them, is what the feedback that I was getting from them. We vape because we can get away with it. You can't get away with smoking. So I'm wondering if you've had those conversations with people. Is juuling bought in your store because it's cool and because they're addicted, or is it something they can get away? And
this probably goes back to what Neil said, that the fact that usually you don't end up having those type of conversations.
Right.
You don't have enough time to have those conversations with those individuals to address it. But I will agree to an extent. It's a cool thing to do in the young age. You know, carrying a pack of cigarettes, maybe not as cool, and lighting it. Whereas Juuls, like, the odor is less. I mean, in general, you can sneak it. It's not as big, you know, and that's probably really what it comes down to.
And getting back to you as a businessman, which, you know, like Chris so eloquently said tonight, we don't want to affect anybody's business here. If we did do this, how much would it affect your business?
I mean, without saying numbers, it's 30% of my cigarette sales is substantial.
But see, I'm looking more big picture, because
So big picture,
as you know, I know the wine
just like-
industry very, very well.
So just like, you know, Bill
But if we
Goldberg said-
ban the cigarettes and the tobacco products and the juuling products, what does it do to your wine sales?
I mean, I think it puts a damper on it. But I mean, I don't want to say that it doesn't, right? But it definitely does. Now, was it 10%, 15%, 5%? I couldn't tell you that.
Okay.
You know, I couldn't tell you because all kinds of. But like, put it this way: it may affect more of my beer sales versus my, you know, liquor sales.
Okay.
You know, because the person that usually comes in, you know, that's a regular at my store that gets the same thing, is now maybe going to a liquor store in Hollister or going to Hopkinton instead. You know, because they know they can't get anywhere else in town. You know, so.
Good. Between the sales of when the juuling started here, as well as the e-cigarette started, did your tobacco sales go down and then this increased?
Yes, I mean substantially. I mean the actual cigarette sales went down substantially. Liquor sales, I mean, it's been on a regular kind of incline of steady growth of inflation, more or less. You know, I'm not saying that it's.
But since you've added the e-cigarettes, your cigarette sales have gone down and your e-cigarette sales have gone up. Is that what you're asking, KJ?
I'll be honest. So in my store particularly,
one type went to the other type.
in my store particularly, like, it's an offset. So the person that would buy, you know, I mean, e-cigarettes are a little bit more expensive too, but to some people they last longer. You know, so it's one of those things where I don't need to buy 2 packs of cigarettes. I can just buy a Juul pod and be good for a few extra days, and then I'll come back again. So really the dollar value, it's kind of flatlined. Is really what, you know, it's not like it's taken away from one or the other. But if you take menthol away, it's a substantial hit. Because not in just the Juuls, but, you know, Newport itself, the company's all menthol pretty much.
Yeah.
You know.
If the company doesn't make those products, then you still lose it. Eh?
So, but anyways, I mean, I don't want to keep people because there's a lot of people, but I urge you guys to take into consideration that the fact that it's not just us retailers, and I get it that, yeah, but I just bought them online while sitting here on the thing. So, okay.
Thank you for stepping up. Thank you.
Nice to see you. Thank you. There she is.
I feel like saying good morning. I'm Cheryl Sabara. I am the Director of Policy and Law for the Massachusetts Association of Health Boards. And I'm going to do something I probably shouldn't do. I'm going to add another research article to your pounds of research articles. This one is called Menthol Cigarettes and the Public Health Standard, a Systematic Review. It goes through 82 studies.
Wow.
And the conclusions are that the strength and consistency of the associations in these studies support that the removal of menthol from cigarettes is likely to reduce youth smoking initiation, improve smoking cessation outcomes in adult smokers, and in turn benefit public health.
Thank you.
I was gonna say, you want to grab that one?
And I want to respond to something that was said, I believe, 2.5 hours ago. And it was something that was said in relation to Professor Mike Siegel, who is a professor at the BU School of Public Health. I've known Dr. Siegel for a very, very, very long time. He and I sit on the smoking committee of the Cannabis Control Commission right now in looking at potential social establishments and whether smoking should be permitted or whether it just be vaping or edibles or whatever. And Mike Siegel has for many, many, many years been an avid proponent of electronic cigarettes, claiming, which is absolutely true, that anything, just about anything you can think of, is safer than a combustible cigarette. He has, however, since Juul has become such an epidemic, he has determined that the characteristics of the Juul product are so much different than the characteristics of e-cigarettes from prior years that he believes Juuls are very dangerous. It was quoted that he said that a regulation that would take a Juul product out of a convenience store and leave just combustible Marlboros in the store is an arbitrary regulation. Now, Dr. Siegel is a very brilliant and learned scientist. However, I respectfully submit that he has not read Massachusetts case law on public health and the definition of something that is arbitrary and capricious. We can go back, it must be 25 years now, when the Mass Restaurant Association, which was a tobacco front group, everyone knew that, sued the city of Boston when the city of Boston enacted a secondhand smoke regulation that permitted smoking in designated areas. It was basically a regulation that said you can urinate in this side of a swimming pool, but not in this side. That's how weak the regulation actually was. The court held in Massachusetts that public health regulations do not have to do it all at once. It's reasonable to enact public health regulations gradually. You can only do what the public supports, and I would point to San Francisco when the ballot initiative landslide public support for that ordinance in San Francisco. It is perfectly appropriate to do things gradually. Would we like to restrict combustible tobacco to only adult-only retail stores or eliminate it? Sure, we tried that in Westminster. We didn't, the board did. We knew that the municipality wasn't ready for it. We were threatened with lawsuits, not just from the tobacco industry, but from all of the trade associations. I remember standing in front of the camera with Tom Bryant from NATO. They were all ready to sue us. They were lined up. So it is not arbitrary and capricious from a legal point of view to enact something that is not 100% what you might want to do. And I'm going to stop talking. Thank you, unless you have questions.
I think I know the answer, but I mean, we keep talking about, we are talking about combustible, traditional cigarettes, I call them, and e-cigarettes, and I'm sure I know the answer, but there's no way to segregate the two in a regulation legally.
Oh, there are ways. You could have a separate definition for a nicotine delivery product. What you have now is a comprehensive definition of tobacco products, and that was based on our intent to try to capture any product that the industry could eventually develop, because they're much richer and smarter than we are. The next thing is, I think, a heat stick or something along those lines. So they're constantly developing new products. We combine them all together. It seemed more efficient and it caught more. But you could separate them out.
Yeah,
it's totally within the board's discretion.
Okay, so I didn't know if that was an option.
And that was going to be my question for you, is, say, hypothetically, we enact this, and the industry adapts to it. Do we start back at Stage 1?
Not, you mean if they create a new product?
Correct.
No, not with the comprehensive definition of tobacco product that you have now. We think we've captured anything they could possibly come up with. But again, they're smarter and richer than we are.
They got
So-
a lot deeper pockets than us. Yep,
Exactly.
yep.
So we're not sure, but we think from that definition. And if not, we can amend the
Okay.
definition.
That's what I wanted to hear. Good. Thank you.
Thank
Have a good morning.
Hi, everyone. My name is Mary Cole. I'm from the Greater Boston Tobacco Free Community Partnership. And I think, did you guys all come to the presentation that I had?
Most
you didn't?
of us.
Okay, I was like, I don't think I recognize you. So you guys have heard me talk before, and you know all about vaping from me. And you also know how I talked about that the tobacco and vaping industry are targeting our youth. So actually, that's what I'm going to focus on in my very brief testimony, I swear. And because I think we've heard a lot about menthol, and you guys understand the harms from it and from a public health perspective. But the tobacco and vaping industry, they've been targeting kids since forever. In my talk, I talked about how they make their products sweet, cheap, and easy to get. I want to talk about how they make their products easy to get. One of their main strategies is to put these products in convenience stores. There's lots of convenience stores everywhere. And this is somewhere that kids go to get some candy, to get some drinks, to get ice cream, to get slushies. I don't go in convenience stores. I don't have a purpose to go in convenience stores, but kids do. And people that smoke a lot of the times do as well. And these products they're put right next to the candy. And this is done on purpose. And something else to note too is that the tobacco industry, they really, really wanted these products to be easy to get. They want you to be able to walk down the street and buy tobacco. If you go in the store to get gum, oh, there's tobacco there. Ooh, that looks good. So that's totally done on purpose. And so I think you guys understand really well too that as the Board of Health and from a public health perspective, that you guys need to control the tobacco industry. That you are able to put policies in place to protect our youth. And that's what it's coming down to right now. So something to compare this to as well is right now, as we're seeing the legalization of marijuana, marijuana is only sold in adult-only stores. You have to be 21 or older. But we're in convenience stores, and tobacco products are sold like crazy. And tobacco is a leading cause of preventable death in Massachusetts and the United States. Like, why are these products so easily accessible, and why can kids see them? So I think that's just something to kind of think about, that we've just been so used to tobacco products in convenience stores. But like, why are they in convenience stores? If we did this, if we regulated tobacco products from the start right now, I don't think they would be in convenience stores. And so with this menthol restriction, this is one step closer to protect public health, to protect our youth. And what else do I want to say? And additionally, we know from a public health perspective as well, I have my MPH, so that's my background with all of this, that policy is the gold standard public health work. And I think it's really cool that the Board of Health is able to pass policy to protect public health, because it impacts everyone in the community and even in some of the surrounding communities as well. And like mentioned, you could be one of the first towns to do this, and then other towns around you will follow suit. And I think that's really great. And it shows that you guys care and want to take initiative. Additionally, I think when I talked about how, convenience stores, retailers are really used to selling these products, I think it is something that we have to work together with everyone and say, you are selling deadly products. You see your people every day that come in, they buy a pack, or the youth that see these products as well. And, that has to be a little bit sad to know that you are selling these deadly products to these people every day. So what can we do? And this policy is something that we can do to work together, because we do have a moral obligation to our youth. And I think the convenience stores need to know that as well. And something else, too, is if our retailers, we have our new look at nicotine addiction from DPH that you guys saw when I presented. We have lots of posters and flyers, so if they want to work with us, please feel free to hang those up in your stores if you want to combat youth vaping. So that's something I would love as well, if you guys are interested. And then to our other point, final point, that that big tobacco targets kids. So a lot of people in opposition were speaking about how they don't sell to minors. Kids can't access this. You know, if you're 21 or over, you can't access this. You shouldn't be able to. So access is a key piece of this, but also exposure. So just the part that kids can go in these convenience stores and see these products, and they say, oh, that looks good, I want that. So some data that we have here, have you guys seen this before? I'll give it to you guys then. It's a few years back from DPH. It was our Big Tobacco Targets Kids campaign. But so it's a fact. Research shows kids who shop at stores with tobacco 2 or more times a week are 64% more likely to start smoking than their peers who don't. So that exposure factor is something that's really important to note as well. It's not just access. But yes, I think that should be all for me. Do you guys have any other questions?
Very good, valuable points.
Perfect. I'll give this to you.
Mr. Chair, if I may, bring it right down, that's regional. Thank you, Mary. All the information's good. I just wanted, 2 of your fellows, previous fellows on this board, brought complaints to me about what was just discussed. One was that some of the blues or jewels, I think it was blues, were being put outside on a front entrance to one of our convenience stores, and they actually were, which they're not allowed to do, it has to be behind the counter. They were actually taking the blues, I think they were, out of the container just so they could get those still right out front in front of the
An
eyes.
empty package there?
Yeah. Empty packages. And that's one case. In the other case, another fellow board member previously was coming out of a store, getting a train station ticket, and his youth was with him, and he saw me right outside and said, do you realize they're advertising at my son's height, where he sees all the tobacco advertising right there when I go into a store for one purpose, a train ticket? And I said, you know, we're looking at it, and they're part of this charge, and I'm glad to see the board graduating further on with tobacco concerns. Thank you. I just want to bring that to your light because they were your fellows.
Mr. DeSoni, before you go, and I mentioned earlier that this board has not gotten here by accident or by not doing our due diligence. And just kudos to Mary. Mary did a very informative, and it's on our website and on WACA website, because Chris set it up at Mass Bay Community College. We did a community forum on the effects of vaping, and I encourage any retailer, and Mary, maybe you can provide the data, is your actual vaping PSA? Is there any way that the retailers can have access to that PSA?
Yeah, it's on the Massachusetts.
Oh, you have to come up to the mic, I'm sorry. You got away too fast.
Yeah, so it's totally free to order the Massachusetts Clearinghouse. If I have a card that I can give you guys, I think, from the Mass Clearinghouse.
Okay. And
so,
if anybody's interested,
yeah, so schools are ordering these like crazy coalitions to hand out as well. So
I can send you the link for the Mass Clearinghouse.
Well, actually,
that's where I get all the bags.
That's where I get stuff too. So, Mary, if you can just send me the actual.
I'll email it to you.
The actual link to. I have the link to the clearinghouse. I just need to know exactly where to find it there.
It can be the clearinghouse can be confusing.
Yes, that's why. If you, my card's there. If you don't have.
But Mary, don't run
know.
away because I mean, I had my concerns about vaping and juuling before I saw that video, and then when I saw that video, my words, I was horrified.
Everyone
after
is,
I saw it. So, just so people understand why we're here and gotten to that point, I think it's important to see that content.
Yep. Yeah. The PowerPoint is part of our public record. So if you don't want to watch an hour and a half of a thing and you want to just flip through a PowerPoint slides, there's a lot of. I shared that PowerPoint with my Samantha, and she digested that information.
Oh, good. I'm glad.
It's traveled.
Mark, the Clearinghouse, they've redone their website. It's easy to find.
Okay, thank you.
Oh, good.
It is.
It's still difficult, I think.
Thank you.
Thank
All
you.
right, thank you.
Mr. DeSoni.
Yes, good evening. Mark DeSoni, lifelong resident, 49 Hawthorne Road, still there, and smoke-free. I was thinking like about a day before, and I came into the Board of Health office and said I wasn't going to come. So I broke up my night.
Like a day without sunshine not having you at one of our meetings. Come on.
Thank you. I broke up my night by going to the Ashland High School boys basketball game. I figured, okay, teamwork, good game, and all that stuff.
Did we win?
It was a no.
Okay.
we were going well in the first half and died out in the second half. Okay, this, I was thinking, I said the bad pun up and spoke in my mind, all this is. Now, I want to come with hopefully some few points. First of all, the stores that sell, how do stores like that get into the towns before they actually open up their doors?
Is that a question?
That's a question. And I know the steps because I've been around long enough to see them. And once the store gets established, they get their contents. And they get whatever license they need, permits to sell, whatever they have for state, federal, whatever they need to do. Tobacco is just one, jewel is another that can add it on, but it also is worth educating and parenting at home their own kids for not being accessible to what elders go to get and give to them. The town may be a slow, quiet, family-growing town with less business, more family, less business, but the businesses are economically working, but then again, the families are their children who's getting the Jew, tobacco, whatever, from odors, is an idea that is what looked at first. That's 2 points. Store, how it gets there first in the contents. 2, the parents' home, educating the kids or whatever. And then from there, you have all these regulations and ideas, policies, whatever. The town will hear only when it's their family member. Not only if it's a town, but a family member. This is why I said I wasn't going to come in, but now, what I've been hearing here, I'm not going to go town-wide because that's usually what I usually do. But I'm going to just point home that the policies will be no good if it ever gets, it's newsworthy saying an underage person needed Narcan for marijuana. An underage person is hooked and is now stats in an obituary because of smoke and tobacco vapor use. And the town will look bad because they say, oh, could happen here, somebody bought it in the store, they let the store come into the town, and it goes in an underage person. So it's saying, I haven't been here from the beginning. I saw the policies, yes. And like I did the first meeting here last time when you first introduced them, I'm going to give them back like I did the first time. Because it just doesn't do anything unless it happens to your personal family member.
Okay. Well, thank you, Mark.
Thank you.
Thanks for coming.
Yep.
That is your seat, yeah. Good evening, sir.
Good evening. Thanks so much for your patience in this, and I really appreciate this. My name is Ken Farbstein, and I'm with the Niatex Foundation Network for the Improvement of Addiction Treatment. I submitted a letter of support this morning, Mr. Oram, along with a one-page fact sheet on menthol, and I hope that can be considered as well. I have 4 points, and first of all, I'm a father of a 22-year-old daughter in Needham. And I have my Board of Health to thank for her life. She's a very adventurous kid and a young woman. In a bunch of ways, she tried everything, but she couldn't get tobacco in our town because Needham was first in the country to go to age 21. And so just as you are protecting the youth of Ashland, I think, and will continue to, I just thank you for what you're doing and, as a Board of Health. I want to speak to the British experience with vapes and e-cigs. There was a discussion by the attorney, I think earlier, of the study, and Dr. Hartman. Mr. Oram, I emailed you about 20 minutes ago or so about the question, what I found in the Truth Initiative. So they say that in the UK that the maximum allowable, and the European Union generally, maximum concentration of nicotine is 2% versus the 5% that's sold commonly in the US. So that huge study that the Royal College did, which I have in my backpack with me, is based on a much safer product, a much less toxic product, and their rules about advertising are much more restrictive than ours. So there's not the epidemic there among youth that our FDA head and Surgeon General say is epidemic now. I also have a one-page statement, list of the limitations of that study. It's as well that I'll share with you in a minute. I wanted to quote for one piece of it, because we've talked a lot about menthol and vaping, but not so much in menthol cigarettes. And this is a quote from the Royal College study on page 61. Menthol increases the palatability of cigarette smoke and facilitates deeper inhalation and therefore a higher nicotine dose. In addition, menthol inhibits the metabolism of nicotine to cotinine, thus increasing the effect of nicotine. Menthol facilitates a higher nicotine dose, unquote. So I'll share that with you.
Thank you.
Take that. Thank you.
That was my second point. Well, the third was about the menthol cigarettes. And the fourth and finally, my father was a small businessman. I'm a small businessman. And the way for you small businessmen in the audience, I don't have to tell you, the way that capitalism works is that your income varies. And that's the good news and the bad news of not getting a salary, that you can make more money when times are good and you don't make as much money when times are bad. And my father's income varied all over the place year to year, as mine has for the last 25 years. That's the deal. And you all acted, and I'm so happy that you did, back in April of 2016 to restrict flavored products and to raise the age to 21. And yet these retailers have survived and are still making money, still making a business. Maybe they didn't make as much money. Maybe they won't make as much in menthol. That's the deal. And the great thing about American business is that you find a way, and you find other profitable and hopefully, as Carly Caminiti reminded us, more healthy things to sell. That's my fourth and final point, and I really appreciate all the time and your conscientiousness in listening.
Thank you for taking time.
Yeah, thank you for coming tonight. Much appreciated. Yes, ma'am.
Sorry, I hate to come back up here, but I noticed that you didn't get the data that you asked for, which was about youth who initiate e-cigarettes being more likely to then go on and use combustible cigarettes. So I will send you these sources, the source for these, but that came from a RAND Corporation study that was published in a scientific journal. And I'll just read. Young people who use e-cigarettes are more likely to progress to smoking cigarettes and increase both e-cigarette and cigarette use over time. There's an increase in what is called dual use, so using both e-cigarettes and traditional tobacco products. And then there's another citation here. A study by the University of Pittsburgh Schools of the Health Sciences found that young adults who use e-cigarettes are more than 4 times as likely to begin smoking tobacco cigarettes within 18 months as their peers who do not vape. So I'll send this along.
Thank you very much. I appreciate that.
Thank you. All right, last call. Does anybody else have any further comments or concerns or questions before we end the discussion?
I'll make one last statement, if
Please.
I may. It's been a long couple of hours of listening, but I appreciate everybody, and I know that not everybody stuck around, but I think the most important thing was that we all remained civil. We listened to each other, And that's the most important about this whole, most important part of about this whole type of a process, is that we listen to each other and try and understand from where we all are coming, from everybody's different perspectives. And I can assure everyone in town, all the retailers and everything, that me, and I'm confident that my colleagues here on the board, when we do make a decision to take a vote, not one bit will be taken lightly. Everything you said here tonight, everything that you've sent through email, all the research, all the data, all the statistics, it will all be factored into the decision. We don't, you know, John said we made the big bucks, right? You know, we make the big bucks here. We volunteer. We do this as a volunteer because we care. And we care about you no matter what your position on this subject is. So thank you.
And with that, just so everybody understands the process, because I think the process is, you know, the devil's in the details on this. If you're watching at home or if you're in the audience tonight and you don't want to speak, it is my intention as the chairman to call this to a vote next Tuesday night. We're going to discuss as a member of the board, but I'll commit to putting it on at 8 o'clock on the agenda for next Tuesday. That way we'll have a potential vote on the subject. I'm not saying that we're going to pass it.
I would say a potential vote.
Potential vote on it. And so you have a week to get any more comments, concerns, research, data to us. You can send it to the Board of Health office. But I will schedule this for a vote, for a potential vote for next Tuesday night at 8 p.m. And with that, why don't we take a 5-minute break so everybody can get out, and then we'll finish the rest of the board business after that.
Sure.
So we will resume the Tuesday, January 15, 2019 Board of Health meeting to order at 10:03 p.m. We just completed our public discussion of tobacco regulations and flavors. And I stated right before the break that I would list this as agenda item for 1 week from today. So Tuesday, January 23rd at 8 p.m. for a possible vote after the discussion of the tobacco regulations. And with that, the next item on the agenda.
Tuesday 22nd, not
Tuesday 22nd.
You said 23rd.
Oh, did I? I'm sorry. Good catch. It's late. Tuesday the 22nd. Thank you for catching.
It's morning, as
It
Sarah
is
said.
morning, yes. Thank you. So we have a review of minutes from our December 12th and our December 18th meetings. Those are in your packet. Does the board want to take any action?
Yes, I do.
Okay.
I have one correction for the December 12th.
Okay.
Just have to list the absentee board members as well as the meeting location.
It is listed. It's on the top of the page.
Full address. Oh, it's there, multipurpose.
Multi-purpose room,
Sorry,
300
sorry.
Hills.
I
Okay.
didn't see it. So that's all I have, and then if that's
You want to list
the absentee trustee,
which were Diane and Chris, okay.
fine.
All right. So you're
That's
going to
all.
do that in the form of a motion?
No, for
Or no?
adoption, the corrections, you don't have to have a motion.
Okay, I'm
But
just
the only thing
asking.
is, I'll just make a motion to approve the amended minutes as presented here.
So there's a motion. Is there a second?
Second.
All right, second. Further discussion? Seeing none, all in favor?
Aye.
All right, and then December 18th.
I have no corrections, and looks fine for me, unless somebody else has any corrections.
I think
Oh, no.
If no one else has corrections, I
the 18th.
move that the minutes be approved as presented for the December 18th meeting.
Yeah, because the presentation has corrections in it. But. Yep, I'll second that.
So there's a motion and a second. Further discussion? Seeing none, all in favor?
Aye.
Aye. That's a 5-0. All right, so the meeting minutes, and that does bring us all current up to date to this evening, right? So we're doing a much better job.
A lot of work on Laura's part.
Yes, absolutely. Absolutely, she's the best. Discuss further agenda topics and meeting dates. Before the meeting started tonight, you had concern about a next Tuesday?
Right, I will probably be late anyhow. I have a training that day. I didn't know if we were gonna still hold the meeting, but,
Well, I said we would vote at 8, so I mean, would 7:30 meeting
no,
time?
just, I would leave it at 7. I'll do my best. I might be, start the meeting without me. If I'm a little bit late, I'll just walk in. That's fine.
Okay, I mean, as long as you're
If
comfortable.
there is an
with it.
issue, we can recess and wait for her for a while, that's all.
That is true,
Yeah,
yep.
that's fine.
Okay. But I think it's important that we have a full board.
Sure,
Right.
sure.
Well, and just, if I could just say a couple things.
Please.
I was just talking to Amy, and for me, I got a lot of valuable information out of everybody's presentations, and I, appreciate what you said, because I think it was good that everybody was respectful, and gave valuable information,
Yeah.
on both sides.
Yeah.
I took a lot out of it tonight.
Good, I'm
so
glad.
It was beneficial for me. I don't know if Mark can comment on it, but Framingham probably, I'm assuming, would be a little bit longer to adopt anything versus other communities, but, do we have any buy-in from the other area communities? I know that there's 9 in the region, right, Mark?
There's 9 in our region, and I haven't heard yet what the others are planning.
And I haven't heard anything as well.
But I did mention at one of our regional meetings, there's always strength in numbers.
Yeah, I can tell you that from the discussions I had with Hopkinton, Holliston, and Southborough, and I think I'm getting it right, that Hopkinton voted to not ban it. It was either Hopkinton or Holliston, but I think it was Hopkinton to not ban it. But the other 2 were hoping to move toward it. So 2 out of the 3 were hoping to move toward it, and 1 voted not to ban it. They did discuss it and bring it up,
Okay.
and voted against it, banning it.
And I appreciate everybody doing it at once, but that's not gonna help or
Right.
hinder me one way or the other.
Right.
I'm sorry, I cut you off.
No, I was just wanted to ask you, is, now that we, it's hard not to listen to these people and really, you know, feel some sympathy for, you know, for both sides, you know, because I can definitely see it, you know, from both ways. You know, obviously we're a public health board. I think that is our number one function, you know, bar none, but I definitely respect the business owners being here. Are we gonna, is next week the time that we actually sit down, you know, and publicly discuss what our thoughts and feelings are behind the motives behind how we may potentially vote? Or do we do that tonight and just have a potential vote next week? Because I would like to hear everybody's thoughts on everything that we spoke about, because I think that'll help me rectify some.
Some of the things that I got from tonight, there were a couple of quotes that, in fact, there was one quote by one of the women here that I asked if she can provide a citation for, because I thought it was so powerful that it really belongs in the statement of purpose. So whatever we vote on, I do want to make, I think there definitely would be a couple of changes in there. And something that I mentioned to, you know, Ron during the break, you know, I am sympathetic to the business owners, because it's a change. And when you change the structure of how you're doing business, it's just very difficult. And doing business in general is not an easy thing. I do understand that. But all of them, I would say, every single tobacco retailer in the town of Ashland is considered the sale of tobacco is a convenience item. They're not tobacco shops, is what I'm trying to say, right? So if I'm a smoker and I go to the gas station X on the corner to get gas, and I know they sell cigarettes, I'm stopping in to get a pack of cigarettes because it's there and it's convenient. Just like I might get a quart of milk, or just like I might get a donut if there's a donut there. But if I need gas and they stop selling cigarettes, I'm not gonna not go there because they don't have cigarettes, right? So now, in the case of what we're proposing here, if my particular type of tobacco product is one of the ones we're looking to restrict, again, I'm not gonna go to another town to buy my gas to get my cigarettes. Yeah, I'm gonna go to the other town maybe to buy my cigarettes. But I'm not, my primary source of business with that establishment, whether it be gas from the gas station that sells cigarettes, or milk from the convenience store that sells cigarettes as well, or lottery tickets, I don't think it's gonna change the structure so much that it will have a significant effect. So when you hear a number, you know, when you hear a statistic, like the gentleman from one liquor store that sells cigarettes said, well, menthol makes up about a quarter of my cigarette sales. I question how much of the cigarette sales are to the full business. You know what I'm saying? Like I said, if that's my shop to go buy my bottle of Tito's, I'm still buying my bottle of Tito's from there. And I don't want to minimize that there is an impact, because there definitely is.
There is, yeah.
But I think the last gentleman that spoke said something very compelling. You know, a few years back when we changed it to 21, and we, you know, anytime some regulation is mandated, and it has an impact, those businesses survived. Because when you're a business person, when you own a business, your goal is to survive, and you find a way to survive. Now, would I like to see, and we can't as a board make this happen, but we can maybe encourage it or promote it, would I like to see something where we can incentivize people to do the right thing? You know, if for instance, we don't ban things, and maybe say, you know, if we can't impose a mandatory ban, maybe you can, if you'd consider banning it, you know, there's some incentive that we can provide to the business. Or if we do vote on it, maybe we can work with, say, with Beth, would be a great point person to say, well, what type of businesses are these? Where are they in relation to our town? Who are their customers? And what can we do to find the product that replaces tobacco, or in this case, the menthol products, to help supplement the loss of revenue from that and make it up. You know, so that we're not just the bad guy saying, well, you can't do this anymore and you can't do that. You know, it'd be nice to partner with other resources that we have in town and about to help them, because I said, if we can collaboratively come up with some creative way to replace that revenue, you know, ideally that's best for all of us.
Well, I mean, the reason why I did the agenda the way I did it, there was a Boston Globe reporter here tonight. The Metro West Daily News asked me if they could come to my office tomorrow and interview me about tonight's meeting as well. So there's going to be a couple things. WACA's going to replay this 3 or 4 times. The Boston Globe is going to write a story, and this is going to show up in the Metro West Daily News. And I've learned over the years, you know, as a selectman and, you know, doing this for a long time, a lot of people couldn't come to tonight's meeting, couldn't attend tonight's meeting, didn't even know that what we were discussing tonight. So what it does is it buys the public a week. And I'm not saying it's going to happen, but we could get some further feedback and some, you know, dialogue, and I hope I pray that we do.
Sure.
I pray that we do, and I hope we hear from other, you know, other businesses and other elected leaders in town and other people in the community. I hope that we hear from. It could change people's minds. It could change people's perspectives. So, I mean, we've got a week to look at that. I will tell you, based on my experience, back when we raised the tobacco age to 21 in Ashland. And not that we should ever talk politics at a Board of Health meeting, but it's full disclosure, and everybody at this table knows, chairman of the Republican Party.
Yeah.
How can the chairman of the Republican Party, a pro-business, you know, political platform, you know, come after me as a business owner? Well, and I struggled with it. I struggled mightily with it. I sat right where Ron was sitting, and I didn't know how I was going to vote until 2 seconds before we took the vote. And, you know, my conscience was talking to me on my shoulder, and I knew it was right, and I knew, you know, what I thought was right. And like I said tonight, and, you know, 5 years later, I got, you know, validated, but it was hard. So, I mean, I encourage everybody to go home and clear your head and don't think about this until tomorrow, and then think about it again, and then think about it again over the weekend. And I mean, because any decision that we make is going to be a monumental decision, and it's not, and we're going to make some people really happy, and we're really going to piss off some people. So, yeah. But at the end of the day, let's make sure we're a public health board, and are we making a public health decision, not a personal decision.
Right.
Yeah. So that's the only advice I can give.
In my case, I think that even though the market imbalance that happens because of the lack of these products available, saleable here, it will regain itself. And these stores are all convenience stores. These are meant for convenience of people. So they're not going to be getting inconvenient to go out there to get themselves, so they will come back to the store itself. I don't think they will miss these people. So that's why they will still have their business.
Ron?
You know, when I was reading, you know, our town attorney's response, you know, the one biggest thing I had was what people addressed here, and I did hear, you know, at least the pediatrician from Needham say that, you know, there are potentially pro bono lawyers that would, you know, defend the town decision. But let's say that wasn't on the table. What would the potential monetary, you know, or financial commitment, if there were lawsuits, to the town be? And, you know, how do you mitigate that versus doing whatever we may decide to do? Meaning, if that would pass, is it too big of a battle from a financial standpoint to fight? You know, are you going to ask the taxpayers to pony up $100 more?
No.
Or how does that work?
No, we have the liability insurance.
Well, I was going to say. I mean, I can speak from my years as a selectman. You know, and Diane can. You know, through the Mass Municipal Association, we have insurance, and we're protected up into a point. Now, tonight, it was just an arbitrary number thrown out. If it's a $12 million lawsuit, our insurance company's probably not going to cover all $12 million. But if we chose to do this, and we did get sued, which I'm not going to lie to you, it's probably a good, we could get threatened with a lawsuit. I could almost guarantee you we're gonna get threatened with a lawsuit.
That'll happen the day after.
It'll happen the day after. We'll get threatened with a lawsuit. Will they actually file a lawsuit and go to it, knowing that we are somewhat indemnified by our insurance policy, and it just turns into a paper contest? You know, we paper them, they paper us. Is it worth it? You know, Somerville's a much bigger target than, you know, than we are. I mean, is there a chance of getting sued? Yeah, there is. I mean, I'm not gonna deny it at all. And I would, like you said, it'll be the next morning, you know, that we'll get it. But council did not, and I've read this a couple times, and.
Yeah, so did I, because there's a lot of info in there.
But there's no opinion here.
Right.
There isn't an opinion.
There is
Which
not
is
an
interesting,
opinion.
because if I'm not mistaken, in the first sentence, it says, here's our opinion.
Right. And I wanted to fact check that with the board, because I read it like numerous times going, well, you know, I'm like, what's the bottom line here, you know, like.
It's just like a lawyer, right? Here's my opinion.
Here's my opinion.
Our opinion is, look at all these potential cases.
The reality is,
we were given,
we
Right.
really can't make a decision based on that, in my opinion.
No.
You know, I think, you know, we've got a lot of food for thought.
Right.
I think we've done a lot of talk and a lot of discussion.
You know, it may not be a unanimous decision, because I mean, I am struggling with it in the aspect, I understand there's a problem.
Yeah.
But there's also there's also people who are of age who have a right to purchase these products.
Right.
And if the vendors are doing what they should be, this shouldn't be an issue. Now, clearly, somebody's doing something inappropriately. We can't fix that.
Right.
Nobody's gonna admit that they're selling 5 e-cigarettes in a day to one customer. It's ridiculous. But I would be sitting here a lot more at ease if we were voting to change the age to 21 versus limiting a product for.
But the law is 21.
That's what I'm saying is I would.
Oh.
But when that decision was made by the
That's
board,
why
I wasn't sitting here.
If that
To
was the
me, it's a
decision.
no-brainer.
Yeah.
That's an easy one.
That's-
This one I think is a little more complicated
You're
in my
right,
eyes.
it is.
And I think we should take into consideration if there's a lawsuit, what it's gonna cost us, because it's not, the situation is we are trying to take care of a problem. We want to get to the root of that problem. No matter what we do, we're probably not gonna see a resolution, like, we're not gonna see it right away.
Yeah.
Hopefully, we will see the results of it over time.
Yeah.
Hopefully.
Sure.
But,
Right, well, that's the hope,
but
yeah.
if we do this and we can't fulfill our obligation for these regulations because of a lawsuit or something, that's the problem.
The only other thing I would,
We need to figure out to get to that solution.
and I agree with you on at least the thought process of all that stuff. As far as the idea of the age and the compliance piece, you know, yeah, we have pretty good compliance. We have very strict laws and stuff. But I think the point that was made tonight too, and it's a reality. It's, if you think about it, it's really just a gamble on the retailer's end, right? They don't know when we're going out to check, right? But we're only checking a couple times a year.
Once.
Right, but I
So,
think the retail.
so if they don't
4 times a
comply,
year?
really, you know, now Seasons, I think, made a great argument, right? They have all this equipment, they require all this
3 to
stuff,
4
they do
times
all
a
this
year.
kind of stuff. But, you know, the
They did all
little small
we
guy
really
who
get
can't
one.
afford $100,000 in equipment or $50,000 in equipment, he can basically say, use your judgment, sell it. If we get hit the first time, then we kick
I
back.
think the establishments, if this, you know, was adopted, you know, I mean, I think the establishment would even out for their sales.
Yeah.
I mean, I think people would purchase a regular versus menthol. That's just my opinion. I don't know. I don't smoke. And most of my
Adults
friends.
probably would, and
Adults,
that
right.
was the point, you know?
Right.
But on the other hand, the other point too is by not having the menthol product, we now take away the risk of the kid having their first puff of a cigarette be a menthol one. Because if their first puff is a regular one, there's less of a chance
Correct.
statistically
Yeah.
that, you know what I'm saying?
Yeah, and I understand, and for me, I understand that, and I definitely see that there's more of an issue with the electronic cigarettes. I mean, look at the
For
doctor
sure.
products and how they're marketed, clearly it's an issue.
That's for
And
sure.
I just, again, there was one woman here that said she does smoke, you know, mint e-cigarette, but, I mean, I don't know how many adults are smoking those products.
40% about. I mean, that's the national data.
And Diane, I do
40%,
respect.
I'm sorry, what's the 40%?
Of smokers, of anybody who smokes, they're saying. That's just
40% are using
meth-
electronic mix.
No, oh, I'm sorry. Menthol and mint and flavored is about 40%. I don't know what that other number is.
No, I mean, I absolutely
electronic cigarettes.
respect the point of restricting the sale of something that, is legal. Or, to me, then you could say the same thing about alcohol.
Absolutely.
If you want, or you could say, you know what, I'm drafting a kid that I'm gonna send to Afghanistan at 18, and he can't drink and he can't smoke, but he can get killed.
I know.
I don't.
Where do you draw the line?
Right, well, where do you draw the line?
Yeah.
And so, if.
And like John, I think John made the point, I mean, they clearly put on a pack of cigarettes that it's not good for you.
They're not good for you.
And they're still allowed to sell them.
Right.
so.
And we're still gonna sue you.
But that,
No, we're still gonna sue you.
If we're more worried about the kids, so, one of my girls, wanted to get a tattoo at 14 years old. And, she came to me and asked, and I said, no. She said, Dad, well, just because you don't like it doesn't mean that it's not right. And I said, yeah, you know what? And I'm gonna completely agree with you, but when you're living in my house and I'm paying the bills and you're a kid, it's my job as a parent and as an adult to make maybe not the popular decision for you or not something that you agree with, but at least to make a decision that I don't think will harm you until you're of legal age to make that decision on your own. So for right now, at least in this house where I get to make the rules and laws, and I don't think they're unfair, I'm not allowing you to do it. When you're 18 and you're of legal age and you're out on your own and you can make that decision, I have nothing to say about that, and I'll still love you. You can get as many tattoos as you want, but until you can think clearly enough to realize, you know what, maybe I got a tattoo when I was 14 and it doesn't look so good, and I made the wrong decision because I didn't have the capacity to think that way. And I think that's what we're trying to do for the youth here. That's why all
Right,
these
but I
other
look at-
people
I
are
look
here.
at your
That's why
definite- I look
DEAT.
at that and we could pick it apart at 10:30 at night. But I look at that
Yeah.
and I say that's why we've restricted it to the age 21. Because we do not want any youth at 18 or 19 years old
Agreed,
going into
but-
a convenience
but
store
look at
because
the
they're still young, not making that
It's not
decision.
working because of
And I haven't gotten-
access.
And I mean, I've said it from the, I
Yeah.
have not come to the, I mean, it's just my mentality, I have
Yeah.
not come to the realization that people, adults, 21 or older, are going into a convenience store and buying 5 e-cigarettes and selling them to 5 kids in the parking lot. Maybe it's happening, I have not.
Well, then where are they getting?
I
Yeah.
I don't know. I asked a
Oh,
high school,
right.
one high school student that said that they travel out of state for it. It's
But-
cheaper as well.
Can I expound on your point?
I don't know.
I posted the meeting, and I posted it on your on your Facebook page, and I posted it on the other Ashland Facebook page, and the Ashland Source did an article on it. But think about this. Today, much to my surprise, oh, what's this? We got a letter from the superintendent of the Ashland schools.
Right.
It
I
is
saw that.
emphatically in support of a ban. That tells me we got a problem. Let this roll around in your head. I got a phone call from Elizabeth Warren. We got a letter from Ed Markey. Think about that for a
These are
minute.
powerful people. How come they're not doing it? How come they're not running with this?
Well,
then?
one, the government's
That
shut
raises
down
my-
right now.
No, but that raises my blood pressure, that if you personally are getting phone calls from these dignitaries that we respect, then they should step up to the plate.
But they do. I think they've been
Well,
going to
clearly,
the, they're
if
going to the
communities are
FDA
sitting
and
talking
talking
about
to
this
them.
for 3 hours, they're not doing what they should be doing then.
Well, but see, to that point, and it was the point that I was going to make, this takes courage, and this is putting a stake in the ground and a core value of a community. And let's face it, I mean, it's not an easy thing to do, but to me, the letter from Jim Adams is much more powerful than,
Yeah.
and I appreciate Senator Markey doing it,
Well,
and
those
and I'm
kids
not trying to
also-
minimize what Senator Markey has done here tonight, but more importantly, the superintendent of our schools, unprompted, took it upon himself to send us that letter to let this board know how big of a problem it is. That's a huge
The
statement.
Northborough High School kid came to an
Right.
Ashland Town and Board of Health meeting. That speaks volumes to me.
She's an Ashland resident that
Right.
attends a
Oh,
school
is she?
out of
Okay.
town.
Right.
I apologize.
Right.
I didn't catch.
But
I didn't catch
the
that.
thing
But
is
think about that, the
thing is
superintendent is
we know
begging us
it's
to
a
do it.
huge issue.
Right.
Yeah.
We know it's a huge issue. And again, I'm just stating it because I have not been convinced. Is this going to take care of the problem?
No, it's not.
All right.
Of course.
You know,
It's not.
Yeah,
Well,
it's-
And it would
I
be-
don't-
it would
I don't
be-
see-
it would be
I don't see
irresponsible for
people
us to say
going
it
out
would.
and
Yeah.
handing beer and vodka to, 15 or 16 or 17-year-olds, or every college, frat where they're 18 or under,
Yeah, but doctor, you would never buy an e-cigarette for somebody. Of course you wouldn't.
I
Right.
understand that, but they're getting it somewhere.
Right.
So the only defense we have is to restrict access to the best of our ability and attempt to try to be fair to people that still can, because Cheryl Sabara made a good point about other people saying, well, you know what, ban everything, and then the retailers will be happy because then that puts everybody on a level playing field. They
You know what was kind of
they
interesting?
can't go. But she said you probably can't do it all at one time. So and I don't smoke, but I still respect people's right to do that. But if we can still let them smoke, when smoking started a zillion years ago, there was one flavor, right? There was tobacco, right? That was it.
Unfiltered tobacco.
Right.
If I may on that note, because I've been meaning to jump in
Yeah.
on this, under the definition of characterizing flavors, we may want to reinstate at least the aroma of tobacco. It's not there. It was all wiped out. Most towns, I think Needham and Somerville included, allowed tobacco, so it doesn't eliminate.
Yeah.
Somerville totally did. Needham allowed
Somerville pulled it
tobacco.
off.
Okay.
Mark, what is your recommendation for the
That
board
we
to
put
do?
back tobacco, because then you're not eliminating the electronic units.
Tobacco, right.
What I found
Completely.
interesting.
But the electronic units seem to be more of an issue than the tobacco products.
Flavored.
No, but then
That's
if
what I'm
someone
talking
wants a
about,
pack of
flavor.
cigarettes and their
Right.
reasoning as an adult is to try to quit, at least they'll have a flavor
Right,
in
so
the
you can
electronic
still,
cigarette.
right, so you can still buy a vape
But
that just
That's
is
if-
tobacco
just
that
tobacco.
doesn't have, or
And
it
as
has
you heard-
nicotine in it.
But that's
Exactly,
defeats
as you
what they
heard
just said,
in the
though.
testimony.
Does it?
They were
They
sa-
won't, the youth won't smoke tobacco flavors. They like the they like the mint, the
Right.
wintergreen,
And the
and the
menthol.
menthol.
Right.
What was interesting is Cheryl Sparrow implied that if we were to attempt to remove tobacco sales completely, that there'd be backlash from the tobacco industry in some way. But how is it possible that some towns are dry towns and don't sell liquor? So I mean, if you can't, if you make a decision to be a dry town and not sell liquor, why would you not be able to just?
So I think
sell-
those are really old
Yeah,
laws
we-
that
we-
people
They
aren't
just
probably gonna
stop.
change now, but grandfathering
You know,
people in is
if I
not.
can make a recommendation, it is 10:30. We've been talking about this for 3.5 hours. And I think that we got a lot of information tonight. And
Do we have a right to reduce the number of permits?
what was it?
No.
Why?
Because
You
that
would have
be-
to have.
That would be singling people
Yeah,
out.
I was just gonna say.
No,
that's
we just
not-
put all the 18 numbers and by lottery we take X numbers go away. That's it.
That's
Okay.
opening yourself up to a lawsuit.
I know,
I
I'm
recommend that.
I
with
like
you
what
about
you're
letting
doing.
anybody
What
close
do you
us
mean?
from the
That's-
city. But
that
I
you're
just
not
wanna know
selecting
from Mark,
somebody.
What,
Yes, may I help?
yes, as the director, what do you recommend we do?
Yeah, that's a good
Well,
point.
the first thing is I wouldn't reinstate tobacco. It still leads to the fact that if there is an adult, that adult will at least have an opportunity to purchase a vaping type unit in town with tobacco flavor, if that's their intent. And that way, there's no argument on that.
Why,
But- But I would ban the other flavors, because you already banned flavors such as peach and mango. Why not wintergreen, mint, and menthol? You
well,
know,
again, what was the must have been a rationalization
Well,
on that.
Well,
But it's-
the
well-
reason is that the federal government was still allowing mint, wintergreen, menthol, and tobacco in tobacco products.
They still are, though.
Well,
It was a compromise from the Joe Camel lawsuit.
Yeah.
If you remember the Joe Camel from the late 80s.
that's where it
And
stems, you know.
the FDA made a compromise with the tobacco industry, and at that time it was more of a minority issue.
Yeah.
That predominantly in the African American community.
There was a market for it.
There was a market for it, and in the industry was
market, I should
worried
say.
that they then would be identified as, targeting a gender or a race. So it was a compromise to, stop the lawsuits. But much as the presentation was tonight, well, the kids all think it's a flavor. So, I mean, it's a perception change. Now you fast forward 25 years later, and the kids are all like, well, it is a flavor. And a lot of people, even, people stop me on the street. Well, I thought you banned flavors. Well, we did, but not this and that. So it's a informational, And to Mark's point, though, is if we reinstate the tobacco flavor for the person who really is using e-cigarettes or juuling to get off of combustible cigarettes, it still gives them a path.
Correct.
Gives them a
And
path to do.
It's also a little leeway if you're thinking liability. You're not creating something that's impossible for our vendors to work with. Another area that our vendors should realize, and I think it was emphasized, that they could consider expanding their business with an adult store as part of their business. And they could sell anything they want. And that's available in our code. And so again, so if there's a challenge, that is something that you could say, well, geez, just expand your business.
Would an adult-only store be classified as a liquor store?
No.
No.
They could just sell tobacco products. They're called retail
So they cannot
tobacco
s-
product
They cannot
stores.
sell any other product except for tobacco products.
It's
Well, they can
fine.
sell,
It's
but
called
the-
retail.
others cannot go
any
in
other
there.
product, but it would
Only
be-
21
they
demo
have-
can walk
It
in.
would be a
Go to,
true
like, Watch City Cigar Company. on
smoke
Amazon.
shop. It would be a
Yeah,
true
stores
smoke
usually
shop.
do.
You
Yeah,
couldn't
retail
sell
t-
bubble gum and Slurpees and
Yeah,
soda.
it says an
So-
establishment that is not required to possess a retail food permit whose primary purpose is to sell or offer for sale, but not for resale, tobacco products and tobacco paraphernalia,
New York City
in which the
all
sale of
over
other
the place,
products
not
is
Sherman.
merely incidental. So it doesn't say you can't sell food, but, it pretty much sends, you come to that door, you gotta be 21 to walk in. I don't know if
Cigar bars are popular too.
Yeah, I don't know if,
But we are allowed to also.
the liquor stores just, I'm sorry, I didn't mean to.
Sorry.
Do
Can
not.
you walk into a liquor store at the age of 10?
Yes.
See, because I was going to say, why are the liquor stores arguing? Because you shouldn't be in there anyways if you're under 21, So,
But think about it, Mark. I mean, like, and I'm not
Yeah, I
picking on
didn't
Mr.
know that,
Goldberg, but
yeah.
he's a liquor store / other store.
Yeah,
so
so he
But
couldn't have a
but
hard
he-
time.
it just,
Of
it,
course he does.
it's funny you say this, because I don't have any children, but I know that when you go into to Main Street, when you go into his store, there's a sign that says, "We card the people you're with."
Mhm.
So if
he's
I have
good.
somebody who's under 21 with me, they're not gonna sell me alcohol products or tobacco,
Yeah.
because I have somebody under the age.
Yeah, he's very
I
conscientious.
don't know about that.
Look, drive right by.
I know the
yeah.
sign's there, but I'm not saying that.
Yeah,
I mean, he
I
does
remember
it
it happening to me.
He does that.
With
and
my
he's
niece.
good. He's above and beyond our regulations, so I respect him for that.
Oh, Bill's
And
great.
the other thing, I do apologize. DJ Wilson's correct. He's an attorney. He researched. I researched our bylaws, and I didn't find what he found. We took our regulation and put it in section 29(4) parentheses I. So we're okay with the 300, 300, 300. It was put into the bylaws.
The discussion that we had.
Sorry about that, though. I thought for sure we
He's
had to
buttoned
go
up.
back to the 100, 200,
I-
300.
I know that we temporarily had the other one because we did not go for the town meeting and we went for the town meeting and got approved. That's
Well,
what
in
it is.
2015, our regulations were adopted as a bylaw.
Correct.
Yeah, I didn't know that. Now,
No,
the
I know,
300,
but
300, 300
when we
is
talked
okay.
about this a couple meetings ago, the issue was not the fact that whether the board did it correctly, is that the town meeting had not adopted it.
Well, it's in the bylaws adopted in 2015.
It
For
went to-
non-criminal
whole
disposition?
Yeah, they took our
It
whole,
went to
the
the
whole
But that's not-
regulation. That part of the non-disposition part went into.
But town meeting never adopted that part of non-criminal disposition, that's the
It
discussion
did.
we have.
It did.
I'm not talking about the board,
Yeah.
I'm talking about the town.
No, town meeting did
Yeah,
because
because it's in the bylaws.
what we did was
I just
when
printed
when
out
the
the
board
violations.
adopted it,
29.
we
4I.
couldn't implement it because the town did not agree. So we still used the old numbers.
Yeah.
So,
Once the
okay, so
town
let me clarify,
adopted
so
it.
you're telling me that the fine schedule the town meeting adopted is 300, 300, and 300?
Yes,
Right.
I
Okay.
just found it.
Okay.
DJ found it before me. I found the original. The way it's listed for the Board of Health for non-criminal has the first generic one for 100, 200, 300 for generically most of our regulations. But I went down to I and found it in section I of
So what he
29.
pointed out is our tobacco
Yeah, we're
regulations
okay.
reflect that. I'm not talking about our tobacco I'm talking about the non-criminal the town meeting adopted.
Yeah, no, we adopted non-criminal from our tobacco look under section I.
We're not talking about the same subject, so that's what I'm
Okay.
saying is,
So, but
town
not-
meeting accepted non-criminal disposition originally.
Yeah.
The town had to adopt it,
yeah.
because it's state. We adopted as 100, 200, 300, the
It's-
fine structure.
Yeah, no, I
So
agree.
that's what we talked about a couple weeks ago, is that the town meeting has not adopted the 300, 300, and 300 for non-criminal. That's what we talked about.
Well, why would it be in the bylaw?
It's not, this is,
It's
he's talking
chapter-
about our bylaw,
No, the town's bylaw. The town's-
non-criminal disposition.
Yeah.
Okay, we're gonna play that tape back
Well,
from a
why
couple
don't we-
meetings ago.
No, you're right.
That's not the discussion that happened a couple meetings
Can
ago.
Can I?
I agree with you.
Let me add.
Okay.
I agree with you.
I
You're
just-
you're right.
All right,
You're
all right,
that was
one
the
conversation.
discussion.
One at a time.
Section I was added 11/17/2015 at an annual town meeting, Article 10. 300, 300, 300.
Remember that the meeting that we had in
I
the
forget it was.
He has it
The-
down
no,
here,
no,
it's that
that's
same
the
date
final
as
meeting was
tobacco
adopted
regulations, and it's
right
different
at the,
fines, so.
the library, at the
It's not what you said a couple meetings
It is
ago.
high school library
I
in
was
the evening,
mistaken.
just
Okay,
before the
but-
town meeting.
I apologize, I was
Regardless
mistaken.
of who said what and who misspoke and who said it right, let's
Yeah, no one have to worry, I agree.
let's cooler heads will prevail tomorrow morning. We'll look at it, and then we'll if it needs to be adjusted, we'll adjust it.
Yeah.
That's all.
No, you're 100% right. That is what we said. It was just it was a misspeak.
It was a mistake, I think, yeah.
All right, I'm done.
So the only thing that I would ask us all to do is, between now and the next time we meet, take in what we went through tonight, what we listened to, and all the documentation, and if whatever happens, happens. I'll try my best to pull the current Somerville and Natick, and if there's any language that needs to be beefed up a little bit or tweaked
Had those, didn't we?
to make some of those.
We have 'em.
Yeah, I have them.
Yeah, you gave them to us.
So I will, I'll do my best to make any changes to that draft that seem appropriate.
Okay.
And then, we could come together next week, and while we have it, the goal would be to take a vote, but we could decide that we're not ready to take a vote.
Are we allowed to restrict the percent of nicotine in the jewel? He said in Europe they have 2% limit on the nicotine.
Versus the 5% we have, so.
We have 5%, yes, sir.
Europe is two and a half times less than us. We're at
Asking
5%.
if we
they're
can
2%.
limit that.
Oh, wouldn't that be interesting? I would say
That's probably federal.
it'd be interesting, yeah, because I think that would, if we'd be the only town, they'd be making the, whatever they're called, the pods for,
Yeah.
I don't know.
Yeah,
I
I
don't
don't
know.
Well, I'm gonna put you on the
That-
spot again. What do you recommend we do? Do you recommend we move forward with this ban, as we keep calling it?
With the changes I mentioned, include
Okay.
the aroma of
Okay.
tobacco. I also recommend that you highlight the fact that you can have a retail tobacco store still if you have a license. Gives them an out, gives them an opportunity. And just one note, a vendor
Which
was
means
leaving.
then they could sell flavors?
Yeah, they'd have
Is
to
that
open up a separate section in their
separate section,
building.
right,
Yeah,
so
just
they
like an
could.
optometrist has an optician kind of
Understood.
deal. And then the other thing I just wanna know, which was very nice to hear from a new vendor in town who sells tobacco. He says his tobacco has gone down 30%. He was talking to me on the way out when I was coming back in
Yeah, I
from our
chatted with him
recess.
too.
And he said, but his sandwiches were selling like hotcakes.
Yeah.
So he
That's,
found a way.
The mobile.
Yeah, he found a way. I was very happy. He said,
Yeah.
no, I don't. I told him, I did
Yeah.
tell him 8 o'clock next week is what the board noted, and
Because-
they said you
Well,
can
that's
be
what we
here.
said. That's
But
what we're gonna do.
he indicated to me that he found a way.
Yeah,
Well, I
chatted
know that you were
with him.
recommending that we waited and did this with other communities, so you recommending we move forward alone?
That is the board's decision. I did recommend
Okay, I'm
that.
just asking
I'll-
what
I'll stand by
recommendation
that
from you.
recommendation,
Okay.
but I don't know if the other communities never do it, then.
So would you recommend us doing it on our
Only if
own
the
or
other
with
co-
other
Well,
communities?
as I said just 10 minutes ago, the other communities aren't moving. So if they don't move, then we shouldn't wait. This happened to us before where they weren't moving. I'm like, guys, I'm trying to get them to move, but I'm not their board. I don't work
Yeah.
for their boards, so.
And I think that we do have, they may not be our neighbors, but Somerville and Needham are close enough that they are certainly partners.
Well, again, I do have somewhat of a good memory, because we talked about this a couple meetings ago, that we were going to try to do this collectively with our
Yep,
other
you're right.
communities.
You're
So-
right.
I thought they were going forward. really do.
They're-
To
they're
me,
just
it
not
doesn't,
moving-
to me,
they're
it
not moving
doesn't,
at the
it
same
doesn't
pace
matter
as we
one
are,
way,
though.
it
I
doesn't
just
matter
wanna,
to me,
if we
one iota.
discuss something, I wanna move forward to
Yep.
something, I just wanna make sure
Yep.
that it doesn't get
Nope,
left
you're
behind.
absolutely right. We did discuss that. And, you know,
We
I did
discussed it,
speak
but
to,
I don't think we
I did
came to an
speak to all the
agreement on it,
neighbors.
yeah.
And they're
Right,
just,
but we're discussing, that's why I'm
Yeah.
discussing it now,
Yep.
because we talked about, and that was original, well, I shouldn't say originally, but that was the recommendation the Mark and I talked about last week, was
It would be
doing
best
it-
at strength, there is strength enough
Right.
there.
Well,
It's definitely
Well,
strength in
if you look
numbers.
at it from Needham and Somerville's
We have two at
perspective,
least.
you know, if this does pass, then that would obviously support them as
Mhm.
well. Well, you know, there's another P in the
and it
pie
may help springboard
as
the
well.
2 out of 3
Just curious.
surrounding
Well,
neighbors,
we've-
you know.
I'm
The
hoping
2 out
that-
of, the 2 out of 3 are still considering it.
Right.
They're just moving a little
Okay.
slower than we
Right.
are. And one of them voted against,
Right.
you know. But they did have the discussion at least, so.
And I'll see my fellows and I'll try to
Well,
let
you were
them know
working with
where-
them, right?
Yeah.
Yeah.
Yeah,
You
I spoke,
wanna
I
try to-
spoke,
I mean,
I
have
spoke
they
to
We haven't
them.
done
voted yet,
anything
so.
any
And
recently?
see, and
They're
I think,
just,
I
they're,
think we're
they're just
crossing
not
a,
as far advanced.
I think we're
they're just not
crossing a
far in
line
the
here,
process
guys.
as we are.
Yeah, you're predicting a
we're,
vote
we're,
before you-
we're predicting something that
We're not
hasn't
predicting a
happened.
vote. We're
Well,
just
in
talking-
my opinion, we are. I think
No,
where
I'm
the
just talking about
conversation is
whether-
leading that way. I mean,
Whether other communities are.
No, it wasn't that
it
statement, it was
wasn't, it
just
wasn't
earlier
that, yeah.
discussion.
So,
What was the discussion? I missed it.
Yeah, I don't recall that.
it's late, guys. It's
Yeah.
late. Why don't, somebody wanna go home?
Make a motion to adjourn.
Second.
All in favor?
Aye.
Aye.
Thank you and good night.
Better off, that way no
Right.
decision.
Right.